1. Understanding phobias. 1.1 What are phobias? Phobias are a type of anxiety disorder characterized by an intense and irrational fear of specific objects, situations, or activities. These fears are often disproportionate to the actual danger posed by the object or situation, and they can significantly interfere with a person's daily life and well-being. Phobias can cause individuals to go to great lengths to avoid the feared object or situation, leading to feelings of distress and anxiety. Phobias can develop at any age, although they often begin in childhood or adolescence. They are believed to be influenced by a combination of genetic, environmental, and psychological factors. While the exact cause of phobias is not fully understood, researchers believe that traumatic experiences, learned behaviors, and genetic predisposition may all play a role in their development. There are several different types of phobias, each characterized by a specific fear. Some common types of phobias include specific phobias, social phobias, animal phobias, medical phobias, natural environment phobias, situational phobias, psychological phobias, and childhood phobias. Each type of phobia has its own unique set of triggers and symptoms. Specific phobias are the most common type of phobia and involve an intense fear of a specific object or situation. For example, someone with arachnophobia has an irrational fear of spiders, while someone with acrophobia has a fear of heights. These phobias can cause individuals to experience panic attacks, rapid heartbeat, shortness of breath, and a strong desire to escape the feared object or situation. Social phobias, also known as social anxiety disorder, involve an intense fear of social situations and the fear of being judged or embarrassed in front of others. People with social phobias may avoid social gatherings, public speaking, or any situation where they feel they may be the center of attention. This fear can significantly impact their ability to form relationships, pursue career opportunities, and enjoy social activities. Animal phobias involve an intense fear of specific animals, such as dogs, snakes, insects, or birds. These phobias can cause individuals to experience extreme anxiety and panic when in the presence of the feared animal. They may go to great lengths to avoid encounters with the animal, which can limit their daily activities and quality of life. Medical phobias involve an intense fear of medical procedures, hospitals, or specific medical conditions. People with medical phobias may avoid seeking necessary medical treatment due to their fear, which can have serious consequences for their health. Common medical phobias include the fear of needles, fear of dentists, fear of blood, and fear of hospitals. Natural environment phobias involve an intense fear of specific elements of the natural environment, such as thunder and lightning, water, flying, or darkness. These phobias can cause individuals to avoid certain outdoor activities or experience extreme anxiety when exposed to the feared element. For example, someone with arachnophobia may become paralyzed with fear during a thunderstorm. Situational phobias involve an intense fear of specific situations, such as enclosed spaces, claustrophobia, blushing, arachnophobia, death, thanatophobia, or public speaking, glossophobia. These phobias can cause individuals to experience panic attacks, rapid heartbeat, and a strong desire to escape the situation. Psychological phobias involve an intense fear of phobias themselves or the fear of losing control. For example, someone with phobophobia has a fear of developing a phobia, while someone with pteromorhanophobia has a fear of flying. These phobias can cause individuals to experience extreme anxiety and avoidance behaviors. Childhood phobias are specific phobias that develop in childhood and often resolve on their own as the child grows older. Common childhood phobias include separation anxiety disorder, school phobia, fear of the dark, and specific phobias such as fear of monsters or fear of certain animals. These phobias can cause significant distress for children and may require intervention if they interfere with daily functioning. In conclusion, phobias are a type of anxiety disorder characterized by an intense and irrational fear of specific objects, situations, or activities. They can significantly impact a person's daily life and well-being. Understanding the different types of phobias and their symptoms is an important step in recognizing and addressing these fears. 1.2 Causes of phobias. Phobias are intense and irrational fears of specific objects, situations, or activities. They can cause significant distress and interfere with daily life. While the exact causes of phobias are not fully understood, there are several factors that are believed to contribute to the development of these fears. 1.2.1 Genetic factors. Research suggests that there may be a genetic component to the development of phobias. Studies have shown that individuals with a family history of phobias are more likely to develop phobias themselves. This suggests that there may be certain genes that predispose individuals to developing specific fears. 1.2.2 Environmental factors. Environmental factors can also play a role in the development of phobias. Traumatic experiences, such as being bitten by a dog or being trapped in an elevator, can lead to the development of specific phobias related to those experiences. Additionally, witnessing someone else experiencing fear or trauma can also contribute to the development of phobias. 1.2.3 Learned behavior. Phobias can also be learned through classical conditioning. Classical conditioning occurs when a neutral stimulus becomes associated with a negative or traumatic event, leading to a fear response. For example, if someone has a negative experience with a spider, they may develop a phobia of spiders. 1.2.4 Cognitive factors. Cognitive factors, such as thoughts and beliefs, can also contribute to the development of phobias. For example, individuals who have a tendency to catastrophize or overestimate the likelihood of negative outcomes may be more prone to developing phobias. Additionally, individuals who have a low sense of control or self-efficacy may be more likely to develop phobias as a way of coping with their anxiety. 1.2.5 Neurotransmitters. Imbalances in certain neurotransmitters, such as serotonin and gamma-aminobutyric acid, GABA, have been implicated in the development of phobias. Serotonin is involved in regulating mood and anxiety, while GABA is an inhibitory neurotransmitter that helps to calm the brain. Disruptions in the functioning of these neurotransmitters may contribute to the development of phobias. 1.2.6 Evolutionary factors. Some researchers believe that certain phobias may have an evolutionary basis. For example, the fear of snakes and spiders may have developed as a survival mechanism to protect early humans from potentially dangerous creatures. This theory suggests that certain phobias may be hardwired into our brains as a result of our evolutionary history. 1.2.7 Personality traits. Certain personality traits may also make individuals more susceptible to developing phobias. For example, individuals who are more anxious or prone to experiencing fear may be more likely to develop phobias. Additionally, individuals who have a tendency to avoid or withdraw from new or challenging situations may be more prone to developing phobias as a way of avoiding potential threats. 1.2.8 Cultural factors. Cultural factors can also influence the development of phobias. Different cultures may have different fears and anxieties based on their beliefs, values, and experiences. For example, in some cultures, there may be specific phobias related to supernatural beings or cultural taboos. In conclusion, the causes of phobias are complex and multifaceted. Genetic factors, environmental influences, learned behavior, cognitive factors, neurotransmitter imbalances, evolutionary factors, personality traits, and cultural factors all play a role in the development of phobias. Understanding these causes can help individuals and healthcare professionals in the treatment and management of phobias. 1.3 Types of phobias. Phobias are a type of anxiety disorder characterized by an intense and irrational fear of specific objects, situations, or activities. These fears can be debilitating and can significantly impact a person's daily life. Phobias can be categorized into several different types based on the specific object or situation that triggers the fear response. In this section, we will explore some of the most common types of phobias and delve into their characteristics and effects. 1.3.1 Specific phobias. Specific phobias are the most common type of phobia and involve an intense fear of a particular object or situation. These phobias can range from common fears such as spiders or heights to more unusual fears like fear of buttons or clowns. Some of the most well-known specific phobias include 1.3.1.1 Arachnophobia. Arachnophobia is the fear of spiders and is one of the most prevalent specific phobias. People with arachnophobia may experience extreme anxiety or panic attacks when they encounter spiders or even think about them. This fear can be so intense that it interferes with their daily activities and causes them to avoid certain places or situations where spiders may be present. 1.3.1.2 Acrophobia. Acrophobia is the fear of heights and is another common specific phobia. Individuals with acrophobia may experience intense fear or anxiety when they are in high places or even when they think about being in such situations. This fear can lead to avoidance of tall buildings, bridges, or other elevated areas, which can significantly limit their daily activities. 1.3.1.3 Claustrophobia. Claustrophobia is the fear of enclosed spaces and can cause individuals to feel extreme panic or anxiety when in small or confined spaces. People with claustrophobia may avoid crowded places, elevators, or even small rooms. The fear of being trapped or unable to escape is a common characteristic of claustrophobia. 1.3.1.4 Agoraphobia. Agoraphobia is the fear of being in situations where escape may be difficult or embarrassing. People with agoraphobia often avoid crowded places, public transportation, or any situation where they feel trapped or unable to leave. This fear can be so severe that individuals may become housebound, leading to isolation and a significant impact on their quality of life. 1.3.2 Social phobias. Social phobias, also known as social anxiety disorder, involve an intense fear of social situations or being judged by others. Individuals with social phobias may experience extreme anxiety or embarrassment in social settings, leading to avoidance of social interactions. Some common social phobias include 1.3.2.1 Social anxiety disorder. Social anxiety disorder is characterized by an intense fear of social situations, such as public speaking, meeting new people, or attending social gatherings. Individuals with social anxiety disorder may worry excessively about being judged or humiliated in social settings, leading to avoidance of such situations. 1.3.2.2 Performance anxiety. Performance anxiety is a specific type of social phobia that involves an intense fear of performing in front of others. This fear can manifest in various situations, such as giving a presentation, playing a musical instrument, or participating in sports. Individuals with performance anxiety may experience physical symptoms like trembling, sweating, or a racing heart when faced with these situations. 1.3.2.3 Fear of public speaking. Fear of public speaking, also known as glossophobia, is a common social phobia that involves an intense fear of speaking in front of an audience. Individuals with this phobia may experience extreme anxiety or panic attacks when faced with the prospect of public speaking, leading to avoidance of such situations. 1.3.2.4 Fear of judgment. Fear of judgment is a social phobia characterized by an intense fear of being negatively evaluated by others. Individuals with this phobia may avoid situations where they feel they may be judged, such as social gatherings or expressing their opinions. This fear can significantly impact their self-esteem and social interactions. 1.3.3 Animal phobias. Animal phobias involve an intense fear of specific animals or insects. These phobias can range from common fears like dogs or snakes to more uncommon fears like birds or insects. Some examples of animal phobias include 1.3.3.1 Cynophobia, fear of dogs. Cynophobia is the fear of dogs and can cause individuals to experience extreme anxiety or panic attacks when they encounter dogs or even think about them. This fear can lead to avoidance of places where dogs may be present, making it challenging for individuals to engage in outdoor activities or visit friends who have dogs. 1.3.3.2 Ophidiophobia, fear of snakes. Ophidiophobia is the fear of snakes and is one of the most common animal phobias. Individuals with ophidiophobia may experience intense fear or anxiety when they see snakes, even if they are non-venomous or harmless. This fear can lead to avoidance of outdoor areas or even zoos or nature parks where snakes may be present. 1.3.3.3 Entomophobia, fear of insects. Entomophobia is the fear of insects and can cause individuals to experience extreme fear or disgust when they encounter insects or even think about them. This fear can lead to avoidance of outdoor activities or places where insects may be present, making it challenging for individuals to enjoy nature or engage in certain hobbies. 1.3.3.4 Ornithophobia, fear of birds. Ornithophobia is the fear of birds and can cause individuals to experience intense fear or anxiety when they encounter birds or even think about them. This fear can lead to avoidance of outdoor areas or parks where birds may be present, making it challenging for individuals to enjoy outdoor activities or even walk in public spaces. These are just a few examples of the various types of phobias that individuals may experience. It's important to remember that phobias can vary in severity and impact from person to person. If you or someone you know is struggling with a phobia, seeking professional help can provide guidance and support in managing and overcoming these fears. 1.4 Common symptoms of phobias. Phobias are anxiety disorders characterized by an intense and irrational fear of specific objects, situations, or activities. These fears can cause significant distress and interfere with daily life. While the specific symptoms of phobias can vary depending on the individual and the type of phobia, there are some common symptoms that many people with phobias experience. In this section, we will explore these common symptoms and how they can manifest in individuals with phobias. 1.4.1 Physical symptoms. Phobias can trigger a range of physical symptoms that are often associated with anxiety. These symptoms can include rapid heartbeat. When faced with the object or situation that triggers their phobia, individuals may experience an increased heart rate. This can be accompanied by palpitations or a pounding sensation in the chest. Shortness of breath. Many people with phobias report feeling like they cannot catch their breath or that their breathing becomes shallow and rapid. This can lead to a sensation of suffocation or a feeling of being smothered. Sweating. Excessive sweating is a common symptom of phobias. Individuals may notice that their palms become sweaty or that they experience generalized sweating throughout their body. Trembling or shaking. Phobias can cause individuals to experience uncontrollable trembling or shaking. This can be particularly noticeable in the hands or legs. Nausea or stomach discomfort. Some individuals with phobias may experience gastrointestinal symptoms such as nausea, stomach pain, or an upset stomach. These symptoms can be triggered by the intense anxiety associated with facing their phobia. Dizziness or lightheadedness. Phobias can cause individuals to feel dizzy or lightheaded. This can be accompanied by a feeling of unsteadiness or a sensation that the room is spinning. Chest pain or tightness. The intense anxiety associated with phobias can sometimes manifest as chest pain or a feeling of tightness in the chest. This can be alarming for individuals and may lead them to believe they are having a heart attack. 1.4.2 Cognitive symptoms. In addition to the physical symptoms, phobias can also cause a range of cognitive symptoms. These symptoms can affect an individual's thoughts, perceptions, and overall mental well-being. Some common cognitive symptoms of phobias include intense fear or panic. The primary cognitive symptom of phobias is an overwhelming sense of fear or panic when faced with the object or situation that triggers the phobia. This fear can be irrational and disproportionate to the actual threat posed by the phobic stimulus. Persistent thoughts about the phobia. Individuals with phobias often find that their thoughts are consumed by their fear. They may constantly worry about encountering the phobic stimulus or obsessively think about the potential consequences of facing their fear. Difficulty concentrating. Phobias can make it challenging for individuals to concentrate on tasks or activities unrelated to their fear. Their thoughts may constantly drift back to their phobia, making it difficult to focus on other aspects of their life. Feeling detached or disconnected. Some individuals with phobias may experience a sense of detachment or disconnection from reality when faced with their fear. This can make it difficult for them to fully engage in their surroundings or interact with others. Anticipatory anxiety. The anticipation of encountering the phobic stimulus can be just as distressing as the actual experience. Individuals with phobias may experience intense anxiety leading up to an event or situation that they believe will expose them to their fear. Avoidance behaviors. One of the hallmark cognitive symptoms of phobias is the development of avoidance behaviors. Individuals may go to great lengths to avoid situations or places that could potentially trigger their phobia. This can significantly impact their daily life and limit their ability to engage in activities they enjoy. 1.4.3 Emotional symptoms. Phobias can also have a profound impact on an individual's emotional well-being. The intense fear and anxiety associated with phobias can lead to a range of emotional symptoms, including extreme fear or terror. Individuals with phobias often experience an overwhelming sense of fear or terror when confronted with their phobic stimulus. This fear can be so intense that it feels as though their life is in immediate danger. Panic attacks. Phobias can trigger panic attacks, which are sudden and intense episodes of fear or anxiety. During a panic attack, individuals may experience a rapid heartbeat, shortness of breath, chest pain, and a sense of impending doom. Feelings of helplessness or powerlessness. Phobias can make individuals feel helpless or powerless in the face of their fear. They may believe that they have no control over their phobia and that it will always have a negative impact on their life. Depression or sadness. Living with a phobia can be emotionally draining and isolating. Many individuals with phobias experience feelings of sadness or depression as a result of their fear and the limitations it imposes on their life. Irritability or anger. The constant fear and anxiety associated with phobias can lead to irritability or anger. Individuals may become easily frustrated or agitated, particularly when their phobia is triggered or when they are unable to avoid it. Low self-esteem. Phobias can erode an individual's self-esteem and self-confidence. They may feel ashamed or embarrassed about their fear and may believe that others will judge them harshly for it. It is important to note that the symptoms of phobias can vary in intensity and duration. Some individuals may experience mild symptoms that are manageable, while others may have severe symptoms that significantly impact their daily life. If you or someone you know is struggling with phobias, it is essential to seek professional help to explore treatment options and develop coping strategies. 2. Specific phobias. 2.1 Agoraphobia. Agoraphobia is a specific phobia characterized by an intense fear and avoidance of situations or places where escape might be difficult or embarrassing, or where help may not be readily available in the event of a panic attack or other distressing symptoms. The fear is typically related to being in open spaces, crowded places, or situations that may trigger feelings of being trapped or helpless. Agoraphobia can have a significant impact on a person's daily life, limiting their ability to engage in activities and interact with others. 2.1.1 Understanding agoraphobia. Agoraphobia often develops as a result of experiencing panic attacks or anxiety in certain situations. The fear of having a panic attack becomes so strong that individuals start avoiding places or situations where they believe an attack may occur. Over time, this avoidance behavior can escalate, leading to a restricted and isolated lifestyle. The fear and avoidance associated with agoraphobia can vary in severity. Some individuals may only experience mild anxiety in certain situations, while others may become completely housebound, unable to leave their home without experiencing intense distress. Agoraphobia can be a debilitating condition that significantly impacts a person's quality of life. 2.1.2 Causes of agoraphobia. The exact cause of agoraphobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some potential causes and risk factors include genetics. There may be a genetic predisposition to developing agoraphobia. Individuals with a family history of anxiety disorders or phobias may be more likely to develop agoraphobia themselves. Traumatic experiences. Agoraphobia can sometimes develop after experiencing a traumatic event, such as a panic attack or a situation where escape was difficult or embarrassing. The fear of a recurrence of such an event can lead to the development of agoraphobia. Anxiety disorders. People with other anxiety disorders, such as panic disorder or social anxiety disorder, may be more prone to developing agoraphobia. The fear and avoidance associated with these disorders can contribute to the development of agoraphobia. Personality factors. Certain personality traits, such as being more prone to anxiety or having a tendency to avoid new or unfamiliar situations, may increase the risk of developing agoraphobia. 2.1.3 Symptoms of agoraphobia. Agoraphobia is characterized by both physical and psychological symptoms. These symptoms can vary in intensity and may include panic attacks. Individuals with agoraphobia often experience panic attacks, which are sudden and intense episodes of fear or discomfort. Panic attacks can be accompanied by physical symptoms such as rapid heartbeat, shortness of breath, dizziness, sweating, and trembling. Anxiety. Persistent and excessive anxiety is a common symptom of agoraphobia. This anxiety is typically related to the fear of being in situations where escape may be difficult or embarrassing. Avoidance behavior. People with agoraphobia tend to avoid situations or places that they believe may trigger anxiety or panic attacks. This avoidance can lead to social isolation and a limited lifestyle. Depression. Agoraphobia can often coexist with depression. The limitations imposed by the fear and avoidance can contribute to feelings of sadness, hopelessness, and a loss of interest in activities. Physical symptoms. In addition to the symptoms associated with panic attacks, individuals with agoraphobia may also experience physical symptoms such as chest pain, stomach discomfort, headaches, and muscle tension. 2.1.4 Treatment for agoraphobia. Agoraphobia is a treatable condition, and several approaches can be effective in managing and overcoming the fear and avoidance associated with it. Some common treatment options include cognitive behavioral therapy, CBT. CBT is a type of therapy that focuses on identifying and changing negative thought patterns and behaviors. It helps individuals challenge their fears and develop healthier coping strategies. Exposure therapy, a specific form of CBT, involves gradually exposing individuals to feared situations in a controlled and supportive environment. Medication. In some cases, medication may be prescribed to help manage the symptoms of agoraphobia. Antidepressants and anti-anxiety medications can be used to reduce anxiety and panic symptoms. Support groups. Joining a support group can provide individuals with agoraphobia a safe space to share their experiences, learn from others, and receive support and encouragement. Self-help strategies. Various self-help techniques, such as deep breathing exercises, relaxation techniques, and mindfulness practices, can be beneficial in managing anxiety and reducing the impact of agoraphobia. It's important to remember that treatment for agoraphobia is highly individualized, and what works for one person may not work for another. It's essential to work with a mental health professional to develop a personalized treatment plan that addresses your specific needs and goals. 2.1.5 Living with agoraphobia. Living with agoraphobia can be challenging, but there are strategies that can help individuals manage their condition and improve their quality of life. Some tips for living with agoraphobia include gradual exposure. Gradually exposing yourself to feared situations can help desensitize you to the anxiety and fear associated with agoraphobia. Start with small steps and gradually increase your exposure over time. Seek support. Reach out to friends, family, or support groups who can provide understanding and encouragement. Having a support system can make a significant difference in managing agoraphobia. Practice self-care. Engage in activities that promote relaxation and well-being, such as exercise, meditation, or hobbies that you enjoy. Taking care of your physical and mental health is crucial in managing agoraphobia. Set realistic goals. Set small, achievable goals for yourself and celebrate your progress. Recognize that overcoming agoraphobia is a journey, and every step forward is an accomplishment. Living with agoraphobia may require ongoing effort and support, but with the right treatment and strategies, it is possible to manage the condition and lead a fulfilling life. Remember, you are not alone, and there is help available to support you on your journey towards overcoming agoraphobia. 2.2 Arachnophobia. Arachnophobia is one of the most common specific phobias, characterized by an intense and irrational fear of spiders. For those who suffer from arachnophobia, the mere sight or thought of spiders can trigger extreme anxiety and panic. This fear can be so overwhelming that it interferes with daily life and causes individuals to go to great lengths to avoid any contact with spiders. 2.2.1 Understanding arachnophobia. Arachnophobia is not simply a dislike or aversion to spiders, it is a deep-rooted fear that goes beyond rationality. The fear can be triggered by the sight of a spider, even if it is harmless and poses no real threat. The fear may also be triggered by the thought or anticipation of encountering a spider, leading to avoidance behaviors. 2.2.2 Causes of arachnophobia. The exact cause of arachnophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some studies suggest that a traumatic experience involving spiders in childhood may contribute to the development of arachnophobia. Others believe that the fear may be learned through observation or cultural influences. 2.2.3 Symptoms of arachnophobia. When faced with a spider or even the thought of encountering one, individuals with arachnophobia may experience a range of physical and psychological symptoms. These symptoms can include intense anxiety or panic attacks, rapid heartbeat and shortness of breath, sweating and trembling, nausea or dizziness, feeling of impending doom or loss of control, avoidance behaviors, such as refusing to enter certain rooms or avoiding outdoor activities. 2.2.4 Coping with arachnophobia. Living with arachnophobia can be challenging, but there are strategies that can help individuals cope with their fear. 2.2.4.1 Education and understanding. Learning more about spiders can help demystify them and reduce fear. Understanding their behavior, characteristics, and the fact that most spiders are harmless can provide reassurance. 2.2.4.2 Gradual exposure. Gradual exposure to spiders, under controlled and safe conditions, can help desensitize individuals to their fear. This can be done through therapy sessions or self-guided exposure exercises. 2.2.4.3 Cognitive behavioral therapy, CBT. CBT is a common therapeutic approach used to treat arachnophobia. It involves identifying and challenging negative thoughts and beliefs about spiders, as well as learning coping mechanisms to manage anxiety. 2.2.4.4 Relaxation techniques. Practicing relaxation techniques, such as deep breathing, meditation, or progressive muscle relaxation, can help individuals manage anxiety and reduce the physical symptoms associated with arachnophobia. 2.2.4.5 Support systems. Seeking support from friends, family, or support groups can provide a sense of understanding and validation. Sharing experiences and learning from others who have overcome arachnophobia can be empowering. 2.2.5 Overcoming arachnophobia. While overcoming arachnophobia may seem daunting, it is possible with the right approach and support. Here are some strategies that can help individuals conquer their fear. 2.2.5.1 Exposure therapy. Exposure therapy involves gradually exposing individuals to spiders in a controlled and safe environment. This can be done through virtual reality simulations, photographs, or even observing spiders from a distance. Over time, repeated exposure can help reduce anxiety and fear responses. 2.2.5.2 Cognitive restructuring. Cognitive restructuring involves challenging and replacing negative thoughts and beliefs about spiders with more rational and positive ones. This can help individuals reframe their perception of spiders and reduce fear. 2.2.5.3 Supportive coaching. Working with a therapist or coach who specializes in phobias can provide guidance and support throughout the process of overcoming arachnophobia. They can help individuals develop personalized strategies and provide encouragement along the way. 2.2.5.4 Celebrating progress. Recognizing and celebrating small victories along the way is important in overcoming arachnophobia. Each step taken towards facing and managing the fear should be acknowledged and celebrated as a significant achievement. By implementing these strategies and seeking professional help if needed, individuals with arachnophobia can gradually overcome their fear and regain control over their lives. It is important to remember that overcoming arachnophobia is a journey, and progress may take time. With patience, perseverance, and the right support, individuals can conquer their fear of spiders and live a life free from the constraints of arachnophobia. 2.3 Claustrophobia. Claustrophobia is a specific phobia characterized by an intense fear of confined spaces or situations where escape may be difficult or impossible. People with claustrophobia often experience extreme anxiety or panic attacks when they find themselves in enclosed spaces such as elevators, small rooms, crowded places, or even tight clothing. This fear can be debilitating and can significantly impact a person's daily life and activities. 2.3.1 Understanding claustrophobia. Claustrophobia is a common phobia that affects millions of people worldwide. It can develop at any age, although it often starts in childhood or adolescence. The exact cause of claustrophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. One theory suggests that claustrophobia may be a result of a traumatic experience or a learned response. For example, if someone had a traumatic experience in a confined space, such as being trapped in an elevator, their brain may associate that experience with fear and trigger a phobic response in similar situations. Another theory suggests that claustrophobia may be linked to evolutionary factors. Some researchers believe that the fear of confined spaces may have been advantageous for our ancestors, as it would have helped them avoid dangerous situations or predators in caves or other enclosed spaces. 2.3.2 Symptoms of claustrophobia. The symptoms of claustrophobia can vary from person to person, but they often include intense fear or anxiety when in enclosed spaces or situations where escape may be difficult, rapid heartbeat or palpitations, shortness of breath or difficulty breathing, sweating or trembling, feeling lightheaded or dizzy, nausea or stomach discomfort, chest pain or tightness, a strong desire to escape or get out of the situation. Panic attacks, which can include symptoms such as a racing heart, chest pain, trembling, and a sense of impending doom. These symptoms can be overwhelming and may lead to avoidance behaviors, where individuals go to great lengths to avoid situations that trigger their claustrophobia. This avoidance can significantly impact a person's quality of life, limiting their ability to travel, attend social events, or even perform everyday tasks. 2.3.3 Treatment for claustrophobia. Fortunately, there are effective treatments available for claustrophobia. The most common treatment approaches include cognitive behavioral therapy, CBT. CBT is a type of therapy that focuses on identifying and changing negative thought patterns and behaviors. In the case of claustrophobia, CBT can help individuals challenge their irrational thoughts about confined spaces and develop coping strategies to manage their anxiety. Exposure therapy. Exposure therapy involves gradually exposing individuals to the situations or objects that trigger their fear in a controlled and supportive environment. By gradually facing their fear, individuals can learn that their anxiety decreases over time, and they can tolerate being in confined spaces without experiencing panic or distress. Relaxation techniques. Learning relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, or mindfulness meditation, can help individuals manage their anxiety symptoms when they find themselves in a triggering situation. Medication. In some cases, medication may be prescribed to help manage the symptoms of claustrophobia. Antidepressants or anti-anxiety medications may be used to reduce anxiety and panic symptoms. However, medication is usually used in conjunction with therapy and is not considered a standalone treatment for claustrophobia. It's important to note that treatment for claustrophobia should be tailored to the individual's specific needs and preferences. Working with a qualified mental health professional can help individuals develop a personalized treatment plan that addresses their unique challenges and goals. 2.3.4 Coping strategies for claustrophobia. In addition to professional treatment, there are several coping strategies that individuals with claustrophobia can use to manage their symptoms. Deep breathing. Practice deep breathing exercises to help calm your body and mind when you start to feel anxious in confined spaces. Take slow, deep breaths in through your nose, hold for a few seconds, and then exhale slowly through your mouth. Visualization. Imagine yourself in a calm and open space when you find yourself in a confined space. Visualize yourself feeling relaxed and at ease, focusing on positive and calming images. Distraction techniques. Engage in activities or thoughts that distract your mind from the fear and anxiety. Listen to music, play a game on your phone, or engage in a conversation with someone to divert your attention. Support system. Reach out to friends, family, or support groups who can provide understanding and encouragement. Sharing your fears and experiences with others who have similar struggles can be comforting and empowering. Self-care. Take care of your overall well-being by practicing self-care activities. Engage in regular exercise, get enough sleep, eat a balanced diet, and engage in activities that bring you joy and relaxation. Remember, overcoming claustrophobia takes time and patience. It's essential to be kind to yourself and celebrate even the smallest victories along the way. With the right support and treatment, it is possible to manage and overcome claustrophobia, allowing you to live a more fulfilling and unrestricted life. 2.4 Acrophobia. Acrophobia, also known as the fear of heights, is one of the most common specific phobias. It is characterized by an intense and irrational fear of being in high places or situations where there is a perceived risk of falling. People with acrophobia often experience extreme anxiety and panic attacks when exposed to heights, even if they are in a safe and controlled environment. 2.4.1 Understanding acrophobia. Acrophobia can vary in severity from person to person. Some individuals may only experience mild discomfort or uneasiness when confronted with heights, while others may have a debilitating fear that significantly impacts their daily lives. The fear can be triggered by various situations, such as standing on a tall building, looking out of a window, or even climbing a ladder. The exact cause of acrophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Traumatic experiences, such as falling from a height or witnessing someone else fall, can contribute to the development of acrophobia. Additionally, individuals with a family history of anxiety disorders or phobias may be more prone to developing acrophobia. 2.4.2 Symptoms of acrophobia. When faced with heights, individuals with acrophobia may experience a range of physical, emotional, and cognitive symptoms. These symptoms can vary in intensity and may include intense fear or anxiety when exposed to heights or even the thought of being in a high place, rapid heartbeat and increased breathing rate, sweating and trembling, nausea or dizziness, feeling lightheaded or faint, panic attacks, which can include symptoms such as chest pain, shortness of breath, and a sense of impending doom. Avoidance of situations that involve heights, such as tall buildings, bridges, or amusement park rides. Difficulty concentrating or thinking clearly when exposed to heights. Feeling a loss of control or a fear of falling. 2.4.3 Impact on daily life. Acrophobia can have a significant impact on an individual's daily life and overall well-being. The fear of heights can limit their ability to participate in activities that involve being at high places, such as traveling, hiking, or even enjoying scenic views. It can also affect their professional life, as certain jobs may require working at heights or being in tall buildings. The avoidance behavior associated with acrophobia can lead to social isolation and a decreased quality of life. Individuals may feel embarrassed or ashamed of their fear, which can further contribute to feelings of anxiety and low self-esteem. Relationships may also be affected, as it can be challenging to engage in activities with friends or family that involve heights. 2.4.4 Treatment for acrophobia. Fortunately, acrophobia is a treatable condition, and there are various approaches that can help individuals overcome their fear of heights. Here are some common treatment options. 2.4.4.1 Cognitive Behavioral Therapy, CBT. Cognitive behavioral therapy is a widely used and effective treatment for acrophobia. It involves working with a therapist to identify and challenge negative thoughts and beliefs related to heights. Through gradual exposure to heights and the use of relaxation techniques, individuals can learn to reframe their thoughts and develop coping strategies to manage their fear. 2.4.4.2 Virtual Reality Therapy. Virtual reality therapy is a relatively new approach that has shown promising results in treating acrophobia. It involves using virtual reality technology to simulate high places and gradually expose individuals to their fear in a controlled and safe environment. This allows individuals to practice facing their fear and build confidence in managing their anxiety. 2.4.4.3 Medication. In some cases, medication may be prescribed to help manage the symptoms of acrophobia. Anti-anxiety medications or beta blockers can be used to reduce anxiety and physical symptoms associated with fear. However, medication is typically used in conjunction with therapy and should be monitored by a healthcare professional. 2.4.4.4 Self-help strategies. There are also self-help strategies that individuals with acrophobia can practice to manage their fear. These include deep breathing exercises, progressive muscle relaxation, and visualization techniques. Engaging in regular physical exercise and maintaining a healthy lifestyle can also contribute to overall anxiety reduction. 2.4.5 Overcoming acrophobia. Overcoming acrophobia takes time and effort, but with the right treatment and support, it is possible to conquer the fear of heights. Gradual exposure to heights, starting with less challenging situations and gradually progressing to more challenging ones, can help desensitize individuals to their fear. Celebrating progress, no matter how small, can also boost confidence and motivation. It is important to remember that everyone's journey in overcoming acrophobia is unique, and progress may vary from person to person. Patience, persistence, and a supportive network of friends, family, and healthcare professionals can make a significant difference in the process of conquering acrophobia. By seeking professional help, utilizing effective treatment strategies, and adopting self-care practices, individuals with acrophobia can regain control over their lives and experience the freedom to engage in activities without the overwhelming fear of heights. 3. Social phobias. 3.1 Social anxiety disorder. Social anxiety disorder, also known as social phobia, is a common mental health condition characterized by an intense fear of social situations. People with social anxiety disorder often experience extreme distress and anxiety when faced with social interactions, such as meeting new people, speaking in public, or participating in group activities. This fear can be so overwhelming that it interferes with their daily lives and can lead to avoidance of social situations altogether. 3.1.1 Understanding social anxiety disorder. Social anxiety disorder is more than just shyness or nervousness in social situations. It is a chronic condition that can cause significant distress and impairment in various areas of life, including work, school, and relationships. Individuals with social anxiety disorder often have an intense fear of being judged, embarrassed, or humiliated in social settings. They may worry excessively about saying or doing something embarrassing or being the center of attention. 3.1.2 Symptoms of social anxiety disorder. The symptoms of social anxiety disorder can vary from person to person but generally include both physical and psychological manifestations. Some common symptoms include physical symptoms: rapid heartbeat, sweating, trembling or shaking, shortness of breath, nausea or stomach discomfort, blushing. Muscle tension. Psychological symptoms: intense fear or anxiety in social situations, fear of being judged or criticized, fear of embarrassing oneself, avoidance of social situations, difficulty speaking or making eye contact, negative self-image and low self-esteem, overanalyzing social interactions. 3.1.3 Causes of social anxiety disorder. The exact cause of social anxiety disorder is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some possible causes and risk factors include genetics. There is evidence to suggest that social anxiety disorder may run in families, indicating a genetic predisposition to the condition. Brain chemistry. Imbalances in certain neurotransmitters, such as serotonin, may contribute to the development of social anxiety disorder. Environmental factors. Traumatic or embarrassing experiences in social situations, such as bullying or public humiliation, can increase the likelihood of developing social anxiety disorder. Personality traits. Individuals who are naturally shy, introverted, or have a tendency to be self-critical may be more susceptible to social anxiety disorder. 3.1.4 Treatment for social anxiety disorder. Fortunately, social anxiety disorder is a highly treatable condition, and there are several effective treatment options available. It is important to seek professional help if you suspect you may have social anxiety disorder. Some common treatment approaches include cognitive behavioral therapy, CBT. CBT is a type of therapy that focuses on identifying and changing negative thought patterns and behaviors associated with social anxiety. It helps individuals develop healthier coping mechanisms and gradually face their fears in a controlled and supportive environment. Medication. In some cases, medication may be prescribed to help manage the symptoms of social anxiety disorder. Antidepressants and anti-anxiety medications can be effective in reducing anxiety and improving overall well-being. Support groups. Joining a support group for individuals with social anxiety disorder can provide a sense of community and understanding. It allows individuals to share their experiences, learn from others, and receive support from people who can relate to their struggles. Lifestyle changes. Incorporating healthy lifestyle habits, such as regular exercise, stress management techniques, and practicing self-care, can help reduce anxiety and improve overall mental well-being. 3.1.5 Coping strategies for social anxiety disorder. In addition to professional treatment, there are several self-help strategies that can help individuals cope with social anxiety disorder. Challenge negative thoughts. Practice challenging and reframing negative thoughts and beliefs about social situations. Replace self-critical thoughts with more realistic and positive ones. Gradual exposure. Gradually expose yourself to feared social situations, starting with less challenging situations and gradually working your way up. This can help desensitize you to the anxiety-provoking situations. Relaxation techniques. Learn and practice relaxation techniques such as deep breathing, progressive muscle relaxation, and mindfulness meditation. These techniques can help reduce anxiety and promote a sense of calm. Self-care. Take care of your physical and emotional well-being by getting enough sleep, eating a balanced diet, engaging in activities you enjoy, and practicing self-compassion. Remember, overcoming social anxiety disorder takes time and patience. With the right support and treatment, it is possible to manage and reduce the impact of social anxiety on your life. 3.2 Performance anxiety. Performance anxiety, also known as stage fright, is a type of social phobia that specifically relates to the fear of performing in front of an audience. It is a common experience for many individuals, ranging from professional performers to students giving presentations in school. Performance anxiety can manifest in various forms, such as trembling, sweating, rapid heartbeat, dry mouth, and even panic attacks. This fear can be debilitating and can significantly impact an individual's ability to perform at their best. 3.2.1 Understanding performance anxiety. Performance anxiety is rooted in the fear of being judged or evaluated negatively by others. It often stems from a fear of failure, making mistakes, or not meeting the expectations of others. The fear of embarrassment or humiliation can be overwhelming, leading to a heightened state of anxiety. This anxiety can be particularly intense when the performance is in a high-pressure situation, such as a public speaking engagement, a musical recital, or a sports competition. 3.2.2 Causes of performance anxiety. The causes of performance anxiety can vary from person to person. Some individuals may have a predisposition to anxiety disorders, while others may develop performance anxiety due to specific experiences or traumas. The fear of judgment and criticism can also be influenced by societal pressures and cultural expectations. Additionally, a lack of self-confidence and negative self-talk can contribute to the development and intensification of performance anxiety. 3.2.3 Symptoms of performance anxiety. Performance anxiety can manifest both physically and emotionally. Some common symptoms include physical symptoms: rapid heartbeat, sweating, trembling or shaking, shortness of breath, nausea or stomach discomfort, dry mouth, dizziness or lightheadedness. Emotional symptoms: intense fear or dread, feeling overwhelmed, negative thoughts or self-doubt, difficulty concentrating, irritability or restlessness, panic attacks. 3.2.4 Coping strategies for performance anxiety. While performance anxiety can be challenging to overcome, there are several strategies that can help individuals manage and cope with their fears. Here are some effective coping strategies. Preparation and practice. Thoroughly prepare for the performance by practicing regularly. Familiarize yourself with the material or routine to build confidence. Rehearse in front of friends or family to simulate the experience of performing in front of an audience. Positive self-talk. Replace negative thoughts with positive affirmations. Remind yourself of past successes and strengths. Focus on the process rather than the outcome. Deep breathing and relaxation techniques. Practice deep breathing exercises to calm the body and mind. Engage in relaxation techniques such as progressive muscle relaxation or guided imagery. Visualize success. Imagine yourself performing confidently and successfully. Visualize positive outcomes and reactions from the audience. Gradual exposure. Gradually expose yourself to performance situations to desensitize yourself to the fear. Start with smaller, less intimidating performances and gradually work your way up to larger audiences. Seek support. Talk to a trusted friend, family member, or mentor about your fears and anxieties. Consider joining a support group or seeking professional help from a therapist or counselor. Utilize distraction techniques. Engage in activities that distract your mind from the anxiety, such as listening to music or practicing mindfulness. Remember, overcoming performance anxiety takes time and practice. Be patient with yourself and celebrate even the smallest victories along the way. With persistence and the right strategies, you can learn to manage your anxiety and perform at your best. 3.3 Fear of public speaking. Public speaking is a common fear that many people experience. It is estimated that up to 75% of individuals have some level of anxiety or fear when it comes to speaking in front of a group of people. This fear, known as glossophobia or fear of public speaking, can range from mild nervousness to severe anxiety that can significantly impact a person's personal and professional life. Understanding glossophobia. Glossophobia is often rooted in the fear of being judged or criticized by others. The fear of public speaking can be triggered by various factors, including past negative experiences, lack of confidence, fear of making mistakes, or the pressure to perform well. Individuals with glossophobia may experience physical symptoms such as rapid heartbeat, sweating, trembling, dry mouth, and difficulty breathing. Causes of fear of public speaking. The fear of public speaking can stem from a variety of causes. Some individuals may have had a traumatic experience in the past, such as being embarrassed or humiliated while speaking in public. Others may have a general fear of being the center of attention or fear of being judged by others. Additionally, individuals who have low self-esteem or lack confidence in their speaking abilities may also develop a fear of public speaking. Impact on personal and professional life. The fear of public speaking can have a significant impact on both personal and professional life. In personal settings, individuals with glossophobia may avoid social gatherings or events where they are required to speak in front of others. This can lead to feelings of isolation and missed opportunities for personal growth and connection. In the professional realm, fear of public speaking can hinder career advancement. Many job positions require effective communication skills, and individuals who struggle with public speaking may find it challenging to excel in their careers. They may avoid opportunities for public speaking engagements, presentations, or leadership roles, limiting their professional growth and potential. Overcoming the fear of public speaking. While the fear of public speaking can be daunting, it is possible to overcome it with time, practice, and the right strategies. Here are some techniques that can help individuals conquer their fear of public speaking. 1. Preparation and practice. One of the most effective ways to combat glossophobia is through thorough preparation and practice. By familiarizing yourself with the topic you will be speaking about and rehearsing your presentation, you can boost your confidence and reduce anxiety. Practice in front of a mirror or with a supportive friend or family member to gain feedback and improve your delivery. 2. Gradual exposure. Gradual exposure is a technique that involves gradually increasing the level of public speaking exposure over time. Start by speaking in front of a small, supportive audience, such as friends or family members. As you become more comfortable, gradually increase the size of the audience or the complexity of the speaking engagement. This gradual approach allows you to build confidence and overcome fear step by step. 3. Positive affirmations. Positive affirmations can be a powerful tool in overcoming the fear of public speaking. Repeat positive statements to yourself before and during your presentation, such as, "I am confident and capable," or, "I have valuable knowledge to share." By replacing negative thoughts with positive ones, you can shift your mindset and boost your self-confidence. 4. Breathing and relaxation techniques. Deep breathing and relaxation techniques can help calm the body and mind before and during a public speaking engagement. Practice deep breathing exercises to slow down your heart rate and relax your muscles. Incorporate relaxation techniques such as progressive muscle relaxation or visualization to reduce anxiety and promote a sense of calmness. Seeking professional help. For individuals with severe glossophobia or those who have tried self-help strategies without success, seeking professional help may be beneficial. Therapists or counselors who specialize in anxiety disorders or phobias can provide guidance and support in overcoming the fear of public speaking. They may use techniques such as cognitive behavioral therapy, CBT, or exposure therapy to help individuals manage their anxiety and develop effective coping strategies. Remember, overcoming the fear of public speaking takes time and practice. With persistence and the right strategies, you can gradually build your confidence and become a more effective and confident public speaker. Embrace the challenge, believe in yourself, and celebrate your progress along the way. 3.4 Fear of judgment. The fear of judgment, also known as social anxiety or social phobia, is a common and debilitating phobia that affects many individuals. It is characterized by an intense fear of being negatively evaluated or judged by others in social situations. People with this phobia often experience extreme self-consciousness and may go to great lengths to avoid situations where they feel they may be scrutinized or criticized. 3.4.1 Understanding fear of judgment. Fear of judgment can manifest in various ways and can be triggered by a wide range of social situations. Some individuals may fear public speaking, while others may feel anxious in social gatherings or when meeting new people. The fear of judgment can be so overwhelming that it interferes with daily life, relationships, and career opportunities. 3.4.2 Causes of fear of judgment. The causes of fear of judgment can be complex and may vary from person to person. Some common factors that contribute to the development of this phobia include negative past experiences. Traumatic experiences such as being humiliated or embarrassed in front of others can leave a lasting impact and contribute to the fear of judgment. Genetic predisposition. Some individuals may have a genetic predisposition to anxiety disorders, including social phobia. If there is a family history of anxiety disorders, the risk of developing fear of judgment may be higher. Environmental factors. Growing up in an environment where criticism and judgment were prevalent can contribute to the development of this phobia. Constant exposure to negative feedback or being overly criticized can make individuals more susceptible to fear of judgment. Low self-esteem. Individuals with low self-esteem may be more prone to fear of judgment. They may have a heightened sensitivity to criticism and a constant fear of not meeting others' expectations. 3.4.3 Symptoms of fear of judgment. The fear of judgment can manifest both physically and emotionally. Some common symptoms include physical symptoms. Individuals with fear of judgment may experience physical symptoms such as rapid heartbeat, sweating, trembling, shortness of breath, nausea, and dizziness. These symptoms are often a result of the body's natural response to stress and anxiety. Emotional symptoms. Fear of judgment can lead to intense feelings of anxiety, fear, and self-consciousness. Individuals may constantly worry about being judged, criticized, or embarrassed in social situations. They may also have a fear of making mistakes or saying something wrong. Avoidance behaviors. To cope with the fear of judgment, individuals may engage in avoidance behaviors. This can include avoiding social situations, public speaking, or any situation where they feel they may be evaluated or judged by others. Negative self-talk. Individuals with fear of judgment often engage in negative self-talk, constantly criticizing themselves and anticipating negative outcomes in social situations. This negative self-talk further reinforces their fear and anxiety. 3.4.4 Impact on daily life. Fear of judgment can have a significant impact on an individual's daily life. It can affect their personal relationships, career opportunities, and overall well-being. Some common ways in which fear of judgment can impact daily life include social isolation. Individuals with fear of judgment may avoid social interactions and isolate themselves to avoid potential judgment or criticism. This can lead to feelings of loneliness and a lack of social support. Career limitations. Fear of judgment can hinder career growth and opportunities. Individuals may avoid job interviews, public speaking engagements, or networking events, limiting their professional development. Low self-esteem. Constant fear of judgment can erode self-esteem and self-confidence. Individuals may doubt their abilities and constantly seek validation from others. Mental health issues. Fear of judgment is often associated with other mental health issues such as depression and anxiety disorders. The constant fear and anxiety can take a toll on an individual's mental well-being. 3.4.5 Overcoming fear of judgment. Overcoming the fear of judgment is possible with the right strategies and support. Here are some techniques that can help individuals manage and overcome their fear. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach that helps individuals identify and challenge negative thought patterns and beliefs. It can help individuals reframe their thoughts about judgment and develop healthier coping mechanisms. Exposure therapy. Exposure therapy involves gradually exposing individuals to feared social situations in a controlled and supportive environment. This helps individuals confront their fears and build confidence in managing social interactions. Mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques such as deep breathing, meditation, and progressive muscle relaxation can help individuals manage anxiety and reduce the physical symptoms associated with fear of judgment. Building a support system. Having a strong support system can provide individuals with the encouragement and reassurance they need to face their fears. Friends, family, or support groups can offer a safe space for individuals to share their experiences and receive support. 3.4.6 Celebrating progress. Overcoming the fear of judgment is a journey, and it is important to celebrate even the smallest victories along the way. Each step taken towards facing fears and engaging in social situations should be acknowledged and celebrated. This positive reinforcement can help individuals build confidence and motivation to continue their progress. Remember, fear of judgment is a common phobia, and you are not alone in your struggles. With the right support and strategies, it is possible to overcome this fear and lead a fulfilling and confident life. 4. Animal phobias. 4.1 Cynophobia, fear of dogs. Cynophobia, also known as the fear of dogs, is a specific phobia that affects a significant number of individuals worldwide. People with cynophobia experience intense fear and anxiety when they encounter dogs or even think about being in the presence of dogs. This fear can be debilitating and can significantly impact their daily lives. 4.1.1 Understanding cynophobia. Cynophobia is a specific phobia that falls under the category of animal phobias. It is characterized by an irrational and excessive fear of dogs. This fear can be triggered by various factors, including past traumatic experiences, witnessing a dog attack, or even hearing stories about dog-related incidents. The fear can be so intense that individuals with cynophobia may go to great lengths to avoid any contact with dogs, including changing their daily routines or avoiding places where dogs are likely to be present. 4.1.2 Causes of cynophobia. The exact causes of cynophobia are not fully understood. However, like other specific phobias, it is believed to be a combination of genetic, environmental, and psychological factors. Some possible causes of cynophobia include traumatic experiences. A traumatic experience involving dogs, such as being bitten or attacked, can trigger the development of cynophobia. The fear response becomes ingrained in the individual's mind, leading to a persistent fear of dogs. Learned behavior. Cynophobia can also be learned through observation or hearing about negative experiences with dogs. If a person grows up in an environment where dogs are portrayed as dangerous or aggressive, they may develop a fear of dogs themselves. Genetic predisposition. Some individuals may have a genetic predisposition to developing specific phobias, including cynophobia. Research suggests that certain genes may play a role in the development of phobias, including those related to fear and anxiety. Other anxiety disorders. Individuals who already have an anxiety disorder, such as generalized anxiety disorder or panic disorder, may be more prone to developing cynophobia. The fear of dogs may be a manifestation of their overall anxiety and fear response. 4.1.3 Symptoms of cynophobia. Cynophobia can elicit a range of physical, emotional, and cognitive symptoms. These symptoms may vary in intensity depending on the individual and the specific situation. Some common symptoms of cynophobia include intense fear or panic when in the presence of dogs or even thinking about dogs, rapid heartbeat and increased breathing rate, sweating and trembling, feeling dizzy or lightheaded, nausea or stomach discomfort, a strong desire to escape or avoid situations where dogs may be present, difficulty concentrating or thinking clearly when dogs are around, feeling a sense of impending doom or danger, irrational thoughts or beliefs about dogs, such as thinking that all dogs are aggressive or will attack, panic attacks, which can include symptoms such as chest pain, shortness of breath, and a sense of impending doom. 4.1.4 Treatment for cynophobia. Fortunately, cynophobia is a treatable condition, and individuals can overcome their fear of dogs with the help of various therapeutic approaches. Some common treatment options for cynophobia include cognitive behavioral therapy, CBT. CBT is a widely used and effective treatment for phobias, including cynophobia. It involves identifying and challenging negative thoughts and beliefs about dogs and gradually exposing the individual to dogs in a controlled and safe manner. Exposure therapy. Exposure therapy is a specific type of CBT that focuses on gradually exposing the individual to their fear in a controlled and systematic way. In the case of cynophobia, this may involve starting with pictures of dogs and gradually progressing to being in the presence of calm and friendly dogs. Medication. In some cases, medication may be prescribed to help manage the symptoms of cynophobia. Antidepressants or anti-anxiety medications may be used to reduce anxiety and panic symptoms associated with the fear of dogs. However, medication is usually used in conjunction with therapy rather than as a standalone treatment. Support groups. Joining a support group for individuals with cynophobia can provide a sense of community and understanding. Sharing experiences and learning from others who have successfully overcome their fear of dogs can be empowering and motivating. Relaxation techniques. Learning and practicing relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, and mindfulness meditation, can help individuals manage their anxiety and fear response when confronted with dogs. It is important to remember that overcoming cynophobia takes time and patience. With the right support and treatment, individuals can gradually reduce their fear and regain control over their lives. 4.2 Ophidiophobia, fear of snakes. Ophidiophobia, also known as the fear of snakes, is a specific phobia that affects a significant number of individuals worldwide. This fear can range from mild discomfort to extreme anxiety and panic attacks when confronted with snakes or even the thought of encountering them. Ophidiophobia is one of the most common animal phobias and can have a profound impact on a person's daily life and well-being. 4.2.1 Understanding Ophidiophobia. Ophidiophobia is often rooted in evolutionary factors and cultural influences. Throughout human history, snakes have been associated with danger and venomous bites, making them a source of fear and caution. This fear may also be influenced by personal experiences, such as witnessing a snake bite or hearing stories about snake encounters. Individuals with ophidiophobia may experience a range of symptoms when exposed to snakes or snake-related stimuli. These symptoms can include rapid heartbeat, shortness of breath, trembling, sweating, nausea, and a strong desire to escape the situation. The fear of snakes can be so intense that it interferes with daily activities, such as avoiding outdoor areas or refusing to visit places where snakes may be present. 4.2.2 Causes of ophidiophobia. The exact causes of ophidiophobia are not fully understood, but several factors may contribute to its development. One possible cause is a traumatic experience involving snakes, such as a snake bite or a close encounter. This traumatic event can create a lasting impression and trigger a fear response whenever snakes are encountered in the future. Another factor that may contribute to ophidiophobia is cultural conditioning. In many cultures, snakes are often portrayed as dangerous or evil creatures, leading to a general fear and aversion towards them. This cultural conditioning can influence an individual's perception of snakes and contribute to the development of ophidiophobia. Additionally, genetic and biological factors may play a role in the development of ophidiophobia. Some studies suggest that individuals with a family history of anxiety disorders or specific phobias may be more prone to developing ophidiophobia. The brain's response to fear and threat may also be different in individuals with ophidiophobia, leading to an exaggerated fear response when exposed to snakes. 4.2.3 Impact of ophidiophobia. Ophidiophobia can have a significant impact on an individual's life, affecting their daily activities, relationships, and overall well-being. The fear of encountering snakes can lead to avoidance behaviors, such as avoiding outdoor activities, parks, or even certain geographical regions known for snake populations. This avoidance can limit opportunities for social interaction and exploration, leading to feelings of isolation and frustration. Furthermore, ophidiophobia can cause significant distress and anxiety when faced with situations that involve snakes, such as visiting zoos, watching nature documentaries, or even seeing images of snakes in books or on television. The fear can be so overwhelming that it interferes with work, school, and personal relationships. 4.2.4 Treatment for ophidiophobia. Fortunately, ophidiophobia is a treatable condition, and individuals can overcome their fear of snakes with the help of various therapeutic approaches. The most common treatment options for ophidiophobia include 4.2.4.1 Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is a widely used and effective treatment for phobias, including ophidiophobia. CBT aims to identify and challenge negative thoughts and beliefs associated with snakes, replacing them with more realistic and positive ones. Through gradual exposure to snakes, either in real life or through imagery, individuals can learn to reevaluate their fear response and develop coping strategies to manage their anxiety. 4.2.4.2 Exposure therapy. Exposure therapy is a specific form of CBT that focuses on gradually exposing individuals to their fear in a controlled and safe environment. In the case of ophidiophobia, exposure therapy involves gradually exposing the individual to snakes, starting with pictures or videos and gradually progressing to real-life encounters. This gradual exposure helps desensitize the individual to the fear and reduces anxiety over time. 4.2.4.3 Relaxation techniques. Relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, and mindfulness meditation, can be helpful in managing anxiety and panic symptoms associated with ophidiophobia. These techniques promote a sense of calmness and relaxation, allowing individuals to better cope with their fear of snakes. 4.2.4.4 Medication. In some cases, medication may be prescribed to help manage the symptoms of ophidiophobia. Anti-anxiety medications or beta blockers can be used on a short-term basis to alleviate anxiety symptoms during exposure therapy or other therapeutic interventions. However, medication alone is not considered a long-term solution and is usually used in conjunction with therapy. 4.2.5 Overcoming ophidiophobia. Overcoming ophidiophobia requires commitment, patience, and a willingness to face one's fears. With the right treatment and support, individuals can gradually reduce their fear and regain control over their lives. It is important to remember that progress may be gradual, and setbacks are normal. Celebrating even small victories along the way can help boost confidence and motivation. By seeking professional help, engaging in therapy, and utilizing relaxation techniques, individuals with ophidiophobia can learn to manage their fear and live a more fulfilling life. With time and effort, it is possible to conquer the fear of snakes and overcome ophidiophobia. 4.3 Entomophobia, fear of insects. Entomophobia, also known as insectophobia, is a specific phobia characterized by an intense and irrational fear of insects. People with entomophobia experience extreme anxiety and distress when they encounter or even think about insects. This fear can be triggered by any type of insect, including spiders, ants, bees, cockroaches, and beetles. The fear may also extend to other arthropods such as scorpions and centipedes. 4.3.1 Understanding entomophobia. Entomophobia is a common phobia that affects many individuals worldwide. The fear of insects can vary in severity, ranging from mild discomfort to debilitating panic attacks. Those with entomophobia often go to great lengths to avoid any contact with insects, which can significantly impact their daily lives and activities. The exact cause of entomophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Traumatic experiences involving insects, such as being bitten or stung, can contribute to the development of entomophobia. Additionally, cultural and societal influences, such as negative portrayals of insects in media, can also play a role in the development of this phobia. 4.3.2 Symptoms of entomophobia. Individuals with entomophobia may experience a wide range of symptoms when confronted with insects or even the thought of them. These symptoms can be both physical and psychological and may include intense fear or panic when seeing or thinking about insects, rapid heartbeat and increased breathing, sweating and trembling, nausea or stomach discomfort, dizziness or lightheadedness, feeling of impending doom or loss of control, avoidance of places or situations where insects may be present, difficulty concentrating or thinking about anything other than the fear of insects, sleep disturbances and nightmares related to insects. Irrational thoughts and beliefs about insects, such as the belief that they are dangerous or will cause harm. 4.3.3 Coping with entomophobia. Living with entomophobia can be challenging, but there are strategies and treatments available to help individuals cope with their fear. Here are some approaches that can be effective in managing entomophobia. 4.3.3.1 Education and understanding. One of the first steps in overcoming entomophobia is to educate oneself about insects. Learning about their behavior, characteristics, and the role they play in the ecosystem can help demystify them and reduce fear. Understanding that most insects are harmless and play important roles in nature can help alleviate anxiety. 4.3.3.2 Gradual exposure therapy. Gradual exposure therapy is a common treatment approach for phobias, including entomophobia. This therapy involves gradually exposing the individual to their fear in a controlled and safe environment. The exposure can start with pictures or videos of insects and gradually progress to real-life encounters. Through repeated exposure, the individual can learn to manage their fear and develop coping mechanisms. 4.3.3.3 Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is another effective treatment for entomophobia. This therapy focuses on identifying and challenging negative thoughts and beliefs about insects. By replacing irrational thoughts with more rational ones, individuals can change their perception of insects and reduce their fear response. 4.3.3.4 Relaxation techniques. Practicing relaxation techniques such as deep breathing, meditation, and progressive muscle relaxation can help individuals manage anxiety and panic symptoms associated with entomophobia. These techniques can be used during exposure therapy or whenever the fear of insects becomes overwhelming. 4.3.3.5 Support systems. Having a strong support system can be beneficial for individuals with entomophobia. Friends, family, or support groups can provide understanding, encouragement, and reassurance during the process of overcoming the fear of insects. Sharing experiences and learning from others who have successfully managed their phobia can be empowering. 4.3.4 Seeking professional help. If entomophobia significantly impacts an individual's daily life and functioning, it is advisable to seek professional help. Mental health professionals, such as psychologists or therapists, can provide specialized treatment and support tailored to the individual's needs. They can guide individuals through therapy techniques and help them develop effective coping strategies. 4.3.5 Conquering entomophobia. Overcoming entomophobia is a journey that requires patience, persistence, and a willingness to face fears. With the right support and treatment, individuals can gradually reduce their fear and regain control over their lives. Celebrating progress, no matter how small, is an important part of the process and can provide motivation to continue working towards conquering entomophobia. Remember, entomophobia is a common phobia, and you are not alone in your fear. With the right tools and support, it is possible to overcome entomophobia and live a life free from the constraints of fear. 4.4 Ornithophobia, fear of birds. Ornithophobia, also known as aviatophobia, is a specific phobia characterized by an intense and irrational fear of birds. People with ornithophobia experience extreme anxiety and panic when they encounter birds or even think about them. This fear can be triggered by any type of bird, including small birds like sparrows or larger birds like eagles. 4.4.1 Understanding ornithophobia. Ornithophobia can develop due to various reasons, including traumatic experiences, negative encounters with birds, or witnessing others experiencing fear or harm from birds. It can also be a learned behavior from parents or caregivers who have a fear of birds themselves. The fear may manifest in different ways, such as fear of being attacked, fear of birds flying near them, or fear of their feathers or beaks. 4.4.2 Symptoms of ornithophobia. When faced with their fear, individuals with ornithophobia may experience a range of physical and psychological symptoms. These symptoms can include intense anxiety or panic attacks, rapid heartbeat and shortness of breath, trembling or shaking, sweating or feeling hot or cold, nausea or stomach discomfort, feeling dizzy or lightheaded, dry mouth or difficulty swallowing, feeling a sense of impending doom or loss of control, avoidance of places or situations where birds may be present, difficulty concentrating or thinking clearly. 4.4.3 Causes of ornithophobia. The exact cause of ornithophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some possible causes include traumatic experiences. A person may develop ornithophobia after experiencing a traumatic event involving birds, such as being attacked or witnessing someone else being attacked. Learned behavior. If a person grows up in an environment where birds are portrayed as dangerous or harmful, they may develop a fear of birds through observational learning. Genetic predisposition. Some individuals may have a genetic predisposition to developing phobias, including ornithophobia. This means that they may be more likely to develop a fear of birds based on their genetic makeup. Cultural and societal influences. Cultural beliefs and societal norms can also play a role in the development of ornithophobia. For example, certain cultures may associate birds with bad luck or negative symbolism, leading to a fear of birds. 4.4.4 Treatment for ornithophobia. Fortunately, ornithophobia is a treatable condition, and individuals can overcome their fear of birds with the help of various therapeutic approaches. Here are some common treatment options. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach for treating phobias. It involves identifying and challenging negative thoughts and beliefs about birds and gradually exposing oneself to birds in a controlled and safe manner. Exposure therapy. Exposure therapy is a specific type of CBT that involves gradually exposing individuals to their fear in a controlled and systematic way. In the case of ornithophobia, this may involve starting with pictures of birds and gradually progressing to being in the presence of birds. Relaxation techniques. Learning relaxation techniques, such as deep breathing exercises or progressive muscle relaxation, can help individuals manage their anxiety and panic symptoms when faced with their fear of birds. Medication. In some cases, medication may be prescribed to help manage the symptoms of ornithophobia. This is typically used in conjunction with therapy and is prescribed on a case-by-case basis. It is important to remember that seeking professional help from a qualified therapist or psychologist is crucial for effectively treating ornithophobia. With the right support and treatment, individuals can overcome their fear of birds and regain control over their lives. 5. Medical phobias. 5.1 Trypanophobia, fear of needles. Trypanophobia, also known as needle phobia, is a specific phobia characterized by an intense and irrational fear of needles or injections. People with trypanophobia often experience extreme anxiety and distress when faced with the prospect of receiving a vaccination, having blood drawn, or undergoing any medical procedure involving needles. 5.1.1 Understanding trypanophobia. Trypanophobia is a common phobia that affects people of all ages and backgrounds. The fear of needles can stem from various factors, including past traumatic experiences, negative associations, or a fear of pain. Some individuals may develop trypanophobia due to a specific incident, such as a painful injection during childhood or witnessing a distressing medical procedure. The fear of needles can be debilitating and may lead to avoidance behaviors, such as avoiding medical appointments or refusing necessary medical treatments. This can have a significant impact on a person's physical health and well-being, as it may prevent them from receiving essential vaccinations, blood tests, or medical interventions. 5.1.2 Symptoms of trypanophobia. People with trypanophobia may experience a range of physical, emotional, and cognitive symptoms when confronted with needles or medical procedures involving injections. These symptoms can include intense anxiety or panic attacks, rapid heartbeat or palpitations, shortness of breath or difficulty breathing, sweating or trembling, nausea or dizziness, feeling faint or lightheaded, dry mouth or difficulty speaking, thoughts of losing control or going crazy, fear of injury or death. Avoidance of medical settings or procedures involving needles. The severity of these symptoms can vary from person to person, with some individuals experiencing mild discomfort and others experiencing extreme distress. 5.1.3 Causes of trypanophobia. The exact cause of trypanophobia is not fully understood. However, several factors may contribute to the development of this phobia. Traumatic experiences. A negative or traumatic experience involving needles, such as a painful injection or a medical procedure gone wrong, can create a lasting fear response. Learned behavior. Observing others' fear or distress during medical procedures involving needles can influence an individual's perception and trigger the development of trypanophobia. Genetic predisposition. Some studies suggest that there may be a genetic component to phobias, including trypanophobia. Individuals with a family history of anxiety disorders or specific phobias may be more likely to develop trypanophobia. Conditioning and reinforcement. Associating needles with pain or discomfort can reinforce the fear response. For example, if a person experiences pain during an injection, they may develop a fear of needles as a result. 5.1.4 Coping strategies for trypanophobia. Living with trypanophobia can be challenging, but there are strategies that can help individuals cope with their fear of needles. Seek support. Talking to a trusted friend, family member, or mental health professional about your fear can provide emotional support and guidance. Gradual exposure. Gradually exposing yourself to needles in a controlled and safe environment can help desensitize your fear response. Start with small steps, such as looking at pictures of needles, and gradually progress to more challenging situations, such as watching videos of injections. Relaxation techniques. Practicing relaxation techniques, such as deep breathing, meditation, or progressive muscle relaxation, can help reduce anxiety and promote a sense of calmness during needle-related situations. Cognitive behavioral therapy, CBT. CBT is a therapeutic approach that focuses on identifying and challenging negative thoughts and beliefs associated with needles. A trained therapist can help you reframe your thoughts and develop healthier coping mechanisms. Distraction techniques. Engaging in activities that divert your attention away from the fear of needles, such as listening to music, playing games, or engaging in deep conversations, can help reduce anxiety during medical procedures. Support of medical professionals. Informing your healthcare providers about your fear of needles can help them provide the necessary support and reassurance during medical procedures. They may offer alternative techniques, such as numbing creams or smaller needles, to minimize discomfort. Remember, overcoming trypanophobia takes time and patience. With the right support and coping strategies, it is possible to manage and reduce the fear of needles, allowing individuals to receive necessary medical care without excessive anxiety or distress. 5.2 Nosocomophobia, fear of hospitals. Nosocomophobia, also known as fear of hospitals, is a specific phobia characterized by an intense and irrational fear of medical facilities. Individuals with nosocomophobia experience extreme anxiety and distress at the mere thought of entering a hospital or medical clinic. This fear can be debilitating and may prevent them from seeking necessary medical care, leading to potential health complications. 5.2.1 Understanding nosocomophobia. Nosocomophobia is a relatively common phobia, affecting people of all ages and backgrounds. The fear is often rooted in a combination of factors, including negative past experiences, fear of medical procedures, and the association of hospitals with illness and death. Individuals with nosocomophobia may have had traumatic experiences in hospitals, such as witnessing a loved one's suffering or receiving unpleasant medical treatments. The fear of hospitals can manifest in various ways, including avoidance. Individuals with nosocomophobia may go to great lengths to avoid hospitals or medical settings. They may cancel or postpone medical appointments, even when they are in need of urgent care. This avoidance behavior can have serious consequences for their health and well-being. Physical symptoms. The fear of hospitals can trigger a range of physical symptoms, including rapid heartbeat, shortness of breath, sweating, trembling, nausea, and dizziness. These symptoms are the body's natural response to the perceived threat and can be overwhelming for the individual. Emotional distress. Nosocomophobia can cause significant emotional distress and anxiety. The fear of hospitals may lead to feelings of helplessness, panic, and a sense of impending doom. Individuals may also experience intrusive thoughts and nightmares related to hospitals. 5.2.2 Causes of nosocomophobia. The exact cause of nosocomophobia is not fully understood. However, several factors may contribute to the development of this fear. Traumatic experiences. Negative experiences in hospitals, such as witnessing a traumatic event or undergoing a painful medical procedure, can leave a lasting impact on an individual's psyche. These experiences can create a strong association between hospitals and fear. Learned behavior. Nosocomophobia can be learned through observation or through the influence of others. If a person grows up in an environment where hospitals are portrayed as scary or dangerous, they may internalize these beliefs and develop a fear of hospitals themselves. Anxiety disorders. Individuals with pre-existing anxiety disorders, such as generalized anxiety disorder or panic disorder, may be more susceptible to developing nosocomophobia. The fear of hospitals can be a manifestation of their overall anxiety and fear of the unknown. Media influence. The portrayal of hospitals in movies, television shows, and media can contribute to the fear of hospitals. Dramatic and sensationalized depictions of medical settings can reinforce negative associations and heighten anxiety. 5.2.3 Coping with nosocomophobia. Living with nosocomophobia can be challenging, especially when medical care is necessary. However, there are strategies and techniques that can help individuals cope with their fear. Seek professional help. Consulting with a mental health professional, such as a psychologist or therapist, can be beneficial in addressing and managing nosocomophobia. They can provide guidance, support, and evidence-based treatments to help individuals overcome their fear. Cognitive behavioral therapy, CBT. CBT is a commonly used therapeutic approach for treating phobias. It focuses on identifying and challenging negative thoughts and beliefs associated with hospitals. Through gradual exposure and relaxation techniques, individuals can learn to reframe their thoughts and reduce anxiety. Support systems. Building a strong support system of friends and family who understand and empathize with the fear of hospitals can provide a sense of comfort and encouragement. Sharing fears and concerns with loved ones can help alleviate anxiety and provide a sense of reassurance. Self-care strategies. Engaging in self-care activities, such as practicing mindfulness, deep breathing exercises, and relaxation techniques, can help manage anxiety associated with nosocomophobia. Taking care of one's physical and emotional well-being is essential in reducing fear and promoting overall mental health. Gradual exposure. Gradual exposure to hospitals and medical settings can help desensitize individuals to their fear. Starting with small steps, such as visiting a hospital lobby or accompanying a friend to a medical appointment, can gradually build confidence and reduce anxiety. Positive affirmations. Using positive affirmations and self-talk can help individuals challenge negative thoughts and replace them with more positive and empowering beliefs. Affirmations such as, "I am safe and in control," or, "I can handle medical situations calmly," can help shift the mindset and reduce fear. Celebrate progress. Recognizing and celebrating small victories along the way is important in overcoming nosocomophobia. Each step taken towards facing the fear of hospitals should be acknowledged and celebrated as a significant achievement. Remember, overcoming nosocomophobia takes time and patience. With the right support and strategies, individuals can gradually reduce their fear and regain control over their lives, allowing them to access the medical care they need without overwhelming anxiety. 5.3 Dentophobia, fear of dentists. Dentophobia, also known as odontophobia or dental anxiety, is a specific phobia characterized by an intense fear or anxiety related to dental procedures and visits to the dentist. People with dentophobia often experience extreme distress and panic at the thought of going to the dentist, which can lead to avoidance of dental care and neglect of oral health. 5.3.1 Understanding dentophobia. Dentophobia is a common phobia that affects people of all ages. The fear of dentists can stem from various factors, including past traumatic dental experiences, fear of pain or discomfort, fear of needles or injections, fear of the dental equipment and sounds, and a general feeling of loss of control during dental procedures. Some individuals may also develop dentophobia due to hearing negative stories or experiences from others. 5.3.2 Symptoms of dentophobia. The symptoms of dentophobia can vary from mild to severe and may include intense anxiety or panic attacks before or during dental appointments, difficulty sleeping the night before a dental visit, rapid heartbeat, sweating, and trembling when thinking about or being in a dental office, feeling nauseous or physically ill at the thought of dental procedures, avoidance of dental care, leading to deteriorating oral health, irritability or anger when confronted with the need for dental treatment, overwhelming fear or distress when seeing dental instruments or hearing dental sounds. 5.3.3 Causes of dentophobia. Dentophobia can develop due to a combination of genetic, environmental, and personal factors. Some common causes of dentophobia include traumatic dental experiences. Previous painful or distressing dental procedures can leave a lasting impact on an individual's perception of dental care, leading to fear and anxiety. Fear of pain. The fear of experiencing pain or discomfort during dental procedures is a significant factor contributing to dentophobia. This fear may be based on personal experiences or stories heard from others. Loss of control. Many individuals feel a loss of control during dental procedures, which can trigger anxiety and fear. The feeling of being confined to the dental chair and unable to communicate can intensify these emotions. Negative associations. Negative stories or experiences shared by family, friends, or the media can create a negative association with dental visits and procedures, leading to dentophobia. Sensory triggers. The sights, sounds, and smells associated with dental offices can trigger anxiety and fear in individuals with dentophobia. 5.3.4 Impact of dentophobia. Dentophobia can have significant consequences on an individual's oral health and overall well-being. The fear and avoidance of dental care can result in delayed or neglected dental treatment. Individuals with dentophobia often postpone or avoid necessary dental procedures, leading to the progression of dental issues and potential complications. Poor oral health. Neglecting dental care can result in the development of cavities, gum disease, and other oral health problems, which can impact overall health and quality of life. Increased dental anxiety. Avoiding dental visits can reinforce the fear and anxiety associated with dentophobia, making it even more challenging to seek dental care in the future. Social and emotional impact. Dentophobia can affect an individual's self-esteem and confidence, as dental issues may cause embarrassment or discomfort in social situations. 5.3.5 Overcoming dentophobia. Overcoming dentophobia is essential for maintaining good oral health and preventing dental problems. Here are some strategies that can help individuals with dentophobia. Communication with the dentist. Openly discussing fears and concerns with the dentist can help alleviate anxiety. Dentists can explain procedures, provide reassurance, and offer options for pain management or relaxation techniques. Gradual exposure. Gradually exposing oneself to dental environments and procedures can help desensitize the fear response. Starting with simple dental visits and gradually progressing to more complex procedures can build confidence over time. Relaxation techniques. Deep breathing exercises, meditation, or listening to calming music can help reduce anxiety during dental appointments. Distraction techniques. Engaging in activities such as listening to audiobooks, watching movies, or using virtual reality headsets during dental procedures can divert attention and reduce anxiety. Seeking professional help. In severe cases of dentophobia, seeking the assistance of a mental health professional who specializes in phobias can be beneficial. They can provide therapy, such as cognitive behavioral therapy, CBT, to address the underlying fears and develop coping strategies. Remember, overcoming dentophobia is a gradual process, and it's important to be patient and kind to yourself throughout the journey. With the right support and strategies, it is possible to manage and overcome the fear of dentists, leading to improved oral health and overall well-being. 5.4 Hemophobia, fear of blood. Hemophobia, also known as blood phobia, is a specific phobia characterized by an intense and irrational fear of blood. Individuals with hemophobia experience extreme anxiety and distress when exposed to blood or situations that involve blood, such as medical procedures, injuries, or even the sight of blood in movies or photographs. This fear can be debilitating and can significantly impact a person's daily life and well-being. 5.4.1 Understanding hemophobia. Hemophobia is a common specific phobia, affecting a significant number of individuals worldwide. The fear of blood can manifest in various ways, ranging from mild discomfort to severe panic attacks. People with hemophobia often go to great lengths to avoid situations that may involve blood, such as avoiding medical appointments or even fainting at the sight of blood. The exact cause of hemophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Traumatic experiences involving blood, such as witnessing a severe injury or undergoing a traumatic medical procedure, can contribute to the development of hemophobia. Additionally, individuals with a family history of anxiety disorders or specific phobias may be more prone to developing hemophobia. 5.4.2 Symptoms of hemophobia. Like other specific phobias, hemophobia can elicit a range of physical, emotional, and cognitive symptoms. These symptoms may vary in intensity depending on the individual and the specific situation. Some common symptoms of hemophobia include intense fear and anxiety. Individuals with hemophobia experience an overwhelming sense of fear and anxiety when exposed to blood or blood-related situations. This fear may be disproportionate to the actual threat posed by the situation. Avoidance behaviors. People with hemophobia often go to great lengths to avoid situations that may involve blood. They may avoid medical procedures, hospitals, or even discussions or images related to blood. Physical reactions. Exposure to blood can trigger a range of physical reactions, including rapid heartbeat, shortness of breath, trembling, sweating, nausea, dizziness, and even fainting. These physical symptoms are the body's natural response to the perceived threat. Cognitive distortions. Individuals with hemophobia may experience distorted thoughts and beliefs about blood. They may catastrophize the potential consequences of being exposed to blood, believing that they will become seriously ill or die. Impact on daily life. Hemophobia can significantly impact a person's daily life and functioning. It may interfere with medical care, relationships, and career opportunities. The fear of blood can lead to social isolation and a decreased quality of life. 5.4.3 Treatment for hemophobia. Fortunately, hemophobia is a treatable condition, and individuals can overcome their fear of blood with the help of appropriate interventions. The most common treatment approaches for hemophobia include cognitive behavioral therapy, CBT. CBT is a widely used and effective treatment for specific phobias, including hemophobia. This therapy aims to identify and challenge irrational thoughts and beliefs about blood, gradually exposing individuals to blood-related situations in a controlled and supportive environment. Exposure therapy. Exposure therapy is a key component of CBT and involves gradually exposing individuals to blood or blood-related situations. This exposure is done in a controlled and systematic manner, allowing individuals to confront their fear and learn that their anxiety will decrease over time. Relaxation techniques. Learning and practicing relaxation techniques, such as deep breathing, progressive muscle relaxation, and mindfulness, can help individuals manage their anxiety and physical symptoms when confronted with blood. Medication. In some cases, medication may be prescribed to help manage the symptoms of hemophobia. Antidepressants or anti-anxiety medications may be used to reduce anxiety and improve overall well-being. However, medication is typically used in conjunction with therapy and not as a standalone treatment. 5.4.4 Coping strategies for hemophobia. In addition to professional treatment, there are several coping strategies that individuals with hemophobia can employ to manage their fear of blood. Education and understanding. Learning about the nature of phobias and understanding the physiological and psychological processes behind the fear of blood can help individuals gain a sense of control and reduce anxiety. Support system. Building a support system of understanding family members, friends, or support groups can provide emotional support and encouragement throughout the treatment process. Self-care. Engaging in self-care activities, such as regular exercise, healthy eating, and sufficient sleep, can help individuals manage their overall anxiety levels and improve their resilience. Gradual exposure. Gradually exposing oneself to blood-related situations, starting with less intense exposures and gradually progressing to more challenging situations, can help desensitize the fear response and build confidence. Positive affirmations. Using positive affirmations and self-talk can help individuals challenge negative thoughts and beliefs about blood. Repeating positive statements, such as, "I am in control of my fear," or, "I can handle this situation," can help shift the mindset towards a more positive and empowered perspective. Celebrate progress. Acknowledging and celebrating small victories and progress made in overcoming the fear of blood can boost motivation and reinforce positive changes. Remember, overcoming hemophobia takes time and patience. With the right support, treatment, and coping strategies, individuals can gradually reduce their fear and regain control over their lives. 6. Natural environment phobias. 6.1 Astrophobia, fear of thunder and lightning. Astrophobia, also known as brontophobia, arachnophobia, or tonitrophobia, is the intense and irrational fear of thunder and lightning. People with astrophobia experience extreme anxiety and panic when they are exposed to thunderstorms or even the sound of thunder and the sight of lightning. This fear can be debilitating and can significantly impact a person's daily life. 6.1.1 Understanding astrophobia. Astrophobia is a specific phobia that falls under the category of natural environment phobias. It is believed to be rooted in a combination of genetic, environmental, and psychological factors. Some individuals may develop astrophobia after experiencing a traumatic event related to thunder and lightning, such as being struck by lightning or witnessing a severe thunderstorm. Others may develop the fear without any specific triggering event. 6.1.2 Causes of astrophobia. The exact causes of astrophobia are not fully understood, but several factors may contribute to its development. One possible cause is a traumatic experience or a negative association with thunder and lightning during childhood. For example, a person may have been frightened by a loud thunderclap or witnessed a lightning strike nearby, leading to the development of a phobia. Another contributing factor may be a genetic predisposition to anxiety disorders. If a person has a family history of anxiety or phobias, they may be more likely to develop astrophobia. Additionally, cultural and societal influences can play a role in the development of astrophobia. If a person grows up in an environment where thunder and lightning are portrayed as dangerous or threatening, they may internalize those beliefs and develop a fear response. 6.1.3 Symptoms of astrophobia. Individuals with astrophobia may experience a range of physical, emotional, and cognitive symptoms when exposed to thunder and lightning. These symptoms can vary in intensity and may include intense anxiety or panic attacks. The fear of thunder and lightning can trigger overwhelming feelings of fear and anxiety. Some individuals may experience panic attacks characterized by rapid heartbeat, shortness of breath, sweating, trembling, and a sense of impending doom. Avoidance behaviors. People with astrophobia often go to great lengths to avoid situations or environments where they might encounter thunder and lightning. They may avoid going outside during storms, stay indoors, or seek shelter in a safe place. Hypervigilance. Individuals with astrophobia may constantly monitor weather forecasts and become hyperaware of any signs of an approaching storm. This constant vigilance can lead to heightened anxiety and stress. Irrational thoughts and beliefs. Astrophobia can cause individuals to develop irrational thoughts and beliefs about thunder and lightning. They may believe that they are in immediate danger or that something terrible will happen during a storm. Physical symptoms. Physical manifestations of astrophobia can include increased heart rate, rapid breathing, sweating, trembling, nausea, dizziness, chest pain, and a feeling of choking or suffocating. Emotional distress. The fear of thunder and lightning can cause significant emotional distress, including feelings of helplessness, terror, and a loss of control. 6.1.4 Coping with astrophobia. Living with astrophobia can be challenging, but there are strategies and techniques that can help individuals cope with their fear. Here are some suggestions. Education and understanding. Learning about thunderstorms, their causes, and the science behind them can help demystify the fear. Understanding that thunder and lightning are natural phenomena and not inherently dangerous can help reduce anxiety. Gradual exposure. Gradually exposing oneself to thunder and lightning can help desensitize the fear response. This can be done by listening to recordings of thunderstorms, watching videos of lightning, or gradually spending time outdoors during mild storms. Relaxation techniques. Practicing relaxation techniques such as deep breathing, meditation, and progressive muscle relaxation can help manage anxiety during thunderstorms. These techniques can help individuals stay calm and reduce the physical symptoms of fear. Seeking support. Talking to a therapist or joining a support group can provide individuals with astrophobia a safe space to share their experiences and learn coping strategies from others who have similar fears. Cognitive behavioral therapy, CBT. CBT is a common therapeutic approach used to treat phobias. It involves identifying and challenging negative thoughts and beliefs associated with thunder and lightning and replacing them with more rational and positive ones. Medication. In some cases, medication may be prescribed to help manage the symptoms of arachnophobia. Antidepressants or anti-anxiety medications may be used to reduce anxiety and panic symptoms. Remember, overcoming arachnophobia takes time and patience. With the right support and treatment, individuals can learn to manage their fear and regain control over their lives. 6.2 Hydrophobia, fear of water. Hydrophobia, also known as aquaphobia, is a specific phobia characterized by an intense and irrational fear of water. Individuals with hydrophobia may experience extreme anxiety or panic attacks when faced with situations involving water, such as swimming pools, lakes, oceans, or even taking a shower. This fear can be debilitating and can significantly impact a person's daily life and activities. 6.2.1 Understanding hydrophobia. Hydrophobia is often rooted in a traumatic experience or a negative association with water. It can develop in childhood or later in life and can vary in severity from person to person. Some individuals may only experience mild discomfort or unease around water, while others may have a paralyzing fear that prevents them from being near any body of water. 6.2.2 Causes of hydrophobia. The exact cause of hydrophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Traumatic experiences, such as near-drowning incidents or witnessing a water-related accident, can trigger the development of hydrophobia. Additionally, cultural or societal influences, such as negative portrayals of water in movies or media, can contribute to the fear. 6.2.3 Symptoms of hydrophobia. Individuals with hydrophobia may experience a range of physical, emotional, and cognitive symptoms when confronted with water-related situations. These symptoms can include intense anxiety or panic attacks, rapid heartbeat and shortness of breath, sweating and trembling, nausea or stomach discomfort, feeling of impending doom or loss of control, avoidance of water-related activities or places, intrusive thoughts or nightmares about water, difficulty concentrating or thinking clearly. 6.2.4 Coping with hydrophobia. Living with hydrophobia can be challenging, but there are strategies and treatments available to help individuals cope with and overcome their fear. Here are some approaches that can be helpful. 6.2.4.1 Therapy. Seeking professional help from a therapist or counselor who specializes in anxiety disorders can be beneficial. Cognitive behavioral therapy, CBT, is often used to treat hydrophobia. This therapy focuses on identifying and challenging negative thoughts and beliefs about water, gradually exposing the individual to water-related situations, and teaching relaxation techniques to manage anxiety. 6.2.4.2 Gradual exposure. Gradual exposure to water is a common technique used in overcoming hydrophobia. This involves starting with small steps, such as looking at pictures of water or standing near a shallow pool, and gradually increasing exposure over time. The goal is to desensitize the individual to the fear and build confidence in their ability to manage their anxiety. 6.2.4.3 Relaxation techniques. Learning and practicing relaxation techniques can help individuals manage their anxiety when faced with water-related situations. Deep breathing exercises, progressive muscle relaxation, and mindfulness meditation are some techniques that can promote a sense of calm and reduce anxiety levels. 6.2.4.4 Support systems. Having a strong support system can make a significant difference in coping with hydrophobia. Friends, family, or support groups can provide understanding, encouragement, and a safe space to share experiences and challenges. Connecting with others who have similar fears can help individuals feel less alone and provide valuable insights and coping strategies. 6.2.5 Overcoming hydrophobia. While hydrophobia can be a challenging fear to overcome, it is possible with time, patience, and the right support. Here are some additional strategies that can aid in overcoming hydrophobia. 6.2.5.1 Positive affirmations. Using positive affirmations can help individuals reframe their thoughts and beliefs about water. Repeating positive statements, such as, "I am safe around water," or, "I am in control of my fear," can gradually shift the mindset and build confidence. 6.2.5.2 Exposure therapy. Exposure therapy involves intentionally exposing oneself to water-related situations in a controlled and gradual manner. This can be done with the guidance of a therapist or by gradually increasing exposure independently. The goal is to confront the fear and gradually reduce anxiety through repeated exposure. 6.2.5.3 Celebrating progress. Recognizing and celebrating small victories along the way is essential in overcoming hydrophobia. Each step taken towards facing the fear should be acknowledged and rewarded, as it signifies progress and growth. This positive reinforcement can help motivate individuals to continue challenging themselves and pushing their boundaries. Conclusion. Hydrophobia, or the fear of water, can be a distressing and debilitating phobia. However, with the right support, therapy, and gradual exposure, individuals can learn to manage and overcome their fear. It is important to remember that everyone's journey is unique, and progress may take time. By taking small steps and seeking professional help, individuals can regain control over their lives and enjoy water-related activities without fear. 6.3 Aerophobia, fear of flying. Aerophobia, also known as aviatophobia or aviophobia, is the fear or extreme anxiety associated with flying or being in an aircraft. It is a specific phobia that affects a significant number of individuals worldwide. People with agoraphobia often experience intense fear, panic attacks, and a strong desire to avoid air travel altogether. This fear can be debilitating and can significantly impact their personal and professional lives. 6.3.1 Understanding agoraphobia. Agoraphobia is a complex phobia that can stem from various factors. Some individuals may develop agoraphobia due to a traumatic experience related to flying, such as a previous flight with severe turbulence or a plane crash. Others may develop the fear due to a fear of heights or a lack of control over the situation. Additionally, the fear of being in an enclosed space for an extended period, known as claustrophobia, can also contribute to agoraphobia. 6.3.2 Symptoms of agoraphobia. The symptoms of agoraphobia can vary from person to person, ranging from mild anxiety to severe panic attacks. Some common symptoms include intense fear or anxiety when thinking about flying or being in an aircraft, rapid heartbeat, increased breathing rate, and sweating, trembling or shaking, nausea or stomach discomfort, dizziness or lightheadedness, chest pain or tightness, feeling of impending doom or a sense of losing control, panic attacks, which can include symptoms such as shortness of breath, chest pain, and a fear of dying. 6.3.3 Causes of agoraphobia. Agoraphobia can develop due to a combination of genetic, environmental, and psychological factors. Some potential causes include traumatic experiences. A previous traumatic experience related to flying, such as a turbulent flight or witnessing a plane crash, can trigger the development of agoraphobia. Learned behavior. If a person grows up in an environment where others around them display fear or anxiety towards flying, they may learn to associate flying with danger and develop agoraphobia. Media influence. News reports or movies depicting plane crashes or aviation accidents can contribute to the development of agoraphobia by creating a fear association with flying. Underlying anxiety disorders. Individuals with pre-existing anxiety disorders, such as generalized anxiety disorder or panic disorder, may be more prone to developing agoraphobia. Lack of control. The feeling of being out of control during a flight, combined with the inability to escape, can trigger anxiety and fear in individuals with agoraphobia. 6.3.4 Treatment for agoraphobia. Fortunately, agoraphobia is a treatable condition, and individuals can overcome their fear of flying with the right approach and support. Here are some common treatment options. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach for treating phobias. It involves identifying and challenging negative thoughts and beliefs associated with flying and replacing them with more rational and positive ones. Exposure therapy. This form of therapy involves gradually exposing individuals to their fear of flying in a controlled and supportive environment. It helps desensitize them to the fear and teaches them coping mechanisms to manage anxiety. Relaxation techniques. Learning relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, and mindfulness meditation, can help individuals manage their anxiety and panic symptoms during flights. Medication. In some cases, medication may be prescribed to help manage the symptoms of anxiety associated with agoraphobia. These medications are typically used in conjunction with therapy and under the guidance of a healthcare professional. 6.3.5 Coping strategies for agoraphobia. In addition to professional treatment, there are several coping strategies that individuals with agoraphobia can employ to manage their fear of flying. Education and understanding. Learning about the safety measures and statistics related to air travel can help individuals challenge their irrational fears and gain a better understanding of the low probability of accidents. Support systems. Seeking support from friends, family, or support groups can provide individuals with agoraphobia a safe space to share their fears and receive encouragement and understanding. Distraction techniques. Engaging in activities such as reading, listening to music, or watching movies during a flight can help divert attention from anxious thoughts and reduce anxiety levels. Breathing exercises. Practicing deep breathing exercises before and during a flight can help regulate breathing and promote relaxation. Positive self-talk. Using positive affirmations and self-talk can help individuals reframe their thoughts and replace negative beliefs with more positive and empowering ones. Gradual exposure. Gradually exposing oneself to flying experiences, starting with short flights or virtual simulations, can help build confidence and reduce anxiety over time. Remember, overcoming agoraphobia takes time and patience. It is essential to seek professional help and support to develop effective coping mechanisms and regain control over your fear of flying. With the right strategies and support, you can conquer your fear and experience the freedom of air travel. 6.4 Acrophobia, Fear of darkness. Acrophobia, also known as nyctophobia or scotophobia, is the intense and irrational fear of darkness. Individuals with acrophobia experience extreme anxiety and panic when exposed to darkness or even the mere thought of being in a dark environment. This fear can be debilitating and can significantly impact a person's daily life and overall well-being. 6.4.1 Understanding acrophobia. Acrophobia is a specific phobia that falls under the category of natural environment phobias. It is believed to stem from a combination of genetic, environmental, and psychological factors. Traumatic experiences, such as being trapped in the dark or witnessing a frightening event in the dark, can contribute to the development of acrophobia. Additionally, cultural and societal influences can also play a role in shaping an individual's fear of darkness. 6.4.2 Symptoms of acrophobia. Like other phobias, acrophobia can manifest in various physical, emotional, and cognitive symptoms. These symptoms may include intense anxiety or panic attacks when exposed to darkness or the thought of darkness, rapid heartbeat and shortness of breath, trembling or shaking, sweating or feeling clammy, nausea or dizziness, feeling a loss of control or a sense of impending doom, avoidance of dark places or situations that may lead to darkness, difficulty sleeping or experiencing nightmares related to darkness, constant worry or preoccupation with the fear of darkness, irrational thoughts or beliefs about the dangers associated with darkness. 6.4.3 Causes of acrophobia. The exact cause of acrophobia is not fully understood. However, several factors may contribute to its development. These factors include traumatic experiences. A person may develop acrophobia after experiencing a traumatic event in the dark, such as getting lost or being attacked. The fear becomes ingrained in their memory, leading to a phobic response in similar situations. Learned behavior. Children often learn from their parents or caregivers. If a child observes their parents displaying fear or anxiety towards darkness, they may internalize this fear and develop acrophobia themselves. Cultural and societal influences. Cultural beliefs and societal norms can shape an individual's perception of darkness. In some cultures, darkness is associated with danger or evil, which can contribute to the development of acrophobia. Genetic predisposition. Some studies suggest that certain individuals may have a genetic predisposition to developing phobias, including acrophobia. This means that they may be more likely to develop the fear of darkness if they have a family history of phobias or anxiety disorders. 6.4.4 Coping strategies for acrophobia. Living with acrophobia can be challenging, but there are various coping strategies that can help individuals manage their fear. Here are some techniques that may be beneficial. Gradual exposure. Gradually exposing oneself to darkness in a controlled and safe manner can help desensitize the fear response. This can be done by starting with small steps, such as dimming the lights or spending short periods of time in a dark room, and gradually increasing exposure over time. Cognitive behavioral therapy, CBT. CBT is a therapeutic approach that focuses on identifying and challenging negative thought patterns and beliefs associated with darkness. Through CBT, individuals can learn to reframe their thoughts and develop healthier coping mechanisms. Relaxation techniques. Practicing relaxation techniques, such as deep breathing, meditation, or progressive muscle relaxation, can help reduce anxiety and promote a sense of calmness when faced with darkness. Seeking support. Talking to a trusted friend, family member, or mental health professional about the fear of darkness can provide emotional support and guidance. Support groups or online forums can also be valuable resources for connecting with others who share similar experiences. Self-care strategies. Engaging in self-care activities, such as regular exercise, maintaining a healthy sleep routine, and practicing stress management techniques, can help improve overall well-being and reduce anxiety levels. Professional help. In severe cases, where acrophobia significantly impacts daily life and functioning, seeking professional help from a mental health professional, such as a psychologist or psychiatrist, may be necessary. They can provide specialized treatment options, such as exposure therapy or medication, to alleviate symptoms and manage the fear of darkness. Remember, overcoming acrophobia takes time and patience. With the right support and strategies, individuals can gradually regain control over their fear and live a fulfilling life free from the constraints of acrophobia. 7. Situational phobias. 7.1 Claustrophobia. Claustrophobia is a specific phobia characterized by an intense fear of confined spaces. People with claustrophobia often experience extreme anxiety or panic when they are in situations where they feel trapped or unable to escape. This fear can be triggered by various situations, such as being in an elevator, crowded places, small rooms, or even wearing tight clothing. 7.1.1 Understanding claustrophobia. Claustrophobia is more than just a dislike for small spaces, it is a psychological condition that can significantly impact a person's daily life. The fear of being trapped or confined can lead to avoidance behaviors, causing individuals to limit their activities and avoid situations that may trigger their anxiety. This can have a significant impact on their personal and professional lives. 7.1.2 Causes of claustrophobia. The exact cause of claustrophobia is not fully understood. However, it is believed to be a combination of genetic, environmental, and psychological factors. Some individuals may have a genetic predisposition to developing phobias, including claustrophobia. Traumatic experiences, such as being trapped in a small space or witnessing someone else in a distressing situation, can also contribute to the development of claustrophobia. 7.1.3 Symptoms of claustrophobia. When faced with a triggering situation, individuals with claustrophobia may experience a range of physical and psychological symptoms. These symptoms can vary in intensity and may include rapid heartbeat, shortness of breath, sweating, trembling or shaking, chest tightness or pain, nausea or dizziness, feeling lightheaded or faint, hot or cold flashes, fear of losing control or going crazy, a strong desire to escape or get out of the situation. 7.1.4 Coping with claustrophobia. Living with claustrophobia can be challenging, but there are strategies and techniques that can help individuals cope with their fear. Here are some approaches that may be helpful. 7.1.4.1 Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is a widely used and effective treatment for phobias, including claustrophobia. CBT helps individuals identify and challenge negative thoughts and beliefs associated with their fear. By replacing irrational thoughts with more realistic and positive ones, individuals can gradually reduce their anxiety and fear response. 7.1.4.2 Exposure therapy. Exposure therapy is another common treatment for claustrophobia. It involves gradually exposing individuals to the situations or environments that trigger their fear in a controlled and safe manner. Through repeated exposure, individuals can learn to tolerate and manage their anxiety, ultimately reducing their fear response. 7.1.4.3 Relaxation techniques. Practicing relaxation techniques, such as deep breathing, progressive muscle relaxation, or mindfulness meditation, can help individuals manage their anxiety and reduce the physical symptoms associated with claustrophobia. These techniques can be used both during triggering situations and as a preventive measure to promote overall relaxation and well-being. 7.1.4.4 Support systems. Having a strong support system can be invaluable for individuals with claustrophobia. Friends, family, or support groups can provide understanding, encouragement, and assistance in facing and overcoming their fears. Sharing experiences and learning from others who have successfully managed their claustrophobia can be empowering and inspiring. 7.1.5 Seeking professional help. If claustrophobia significantly impacts your daily life and prevents you from engaging in activities you enjoy or fulfilling your responsibilities, it may be beneficial to seek professional help. Mental health professionals, such as psychologists or therapists, can provide guidance, support, and evidence-based treatments to help you overcome your fear and regain control of your life. Remember, overcoming claustrophobia is a gradual process, and everyone's journey is unique. With the right support, strategies, and determination, it is possible to manage and overcome claustrophobia, allowing you to live a more fulfilling and unrestricted life. 7.2 Erythrophobia, fear of blushing. Erythrophobia, also known as erythrocytophobia or erythrophobia, is a specific phobia characterized by an intense and irrational fear of blushing or the act of blushing itself. People with erythrophobia experience extreme anxiety and distress at the thought of blushing or when they actually blush. This fear can significantly impact their daily lives and social interactions, leading to avoidance behaviors and isolation. 7.2.1 Understanding erythrophobia. Erythrophobia is often rooted in a fear of embarrassment or humiliation. Individuals with this phobia are excessively self-conscious and worry about others noticing their blushing. They may fear that blushing will make them appear weak, vulnerable, or incompetent in social situations. The fear of blushing can become so overwhelming that individuals may go to great lengths to avoid situations that may trigger blushing, such as public speaking, meeting new people, or being the center of attention. 7.2.2 Causes of erythrophobia. The exact cause of erythrophobia is not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some possible causes and contributing factors include genetics. There may be a genetic predisposition to developing erythrophobia. If a close family member has a history of anxiety disorders or phobias, an individual may be more likely to develop erythrophobia. Traumatic experiences. A past traumatic experience, such as being embarrassed or humiliated in front of others, can contribute to the development of erythrophobia. The fear of blushing may be a learned response to avoid similar situations in the future. Social anxiety. Erythrophobia often coexists with social anxiety disorder. Individuals with social anxiety have an intense fear of being judged or evaluated by others, and the fear of blushing can exacerbate their anxiety in social situations. Perfectionism. Individuals with perfectionistic tendencies may be more prone to developing erythrophobia. They may have high standards for themselves and fear that any sign of blushing will be seen as a failure or imperfection. 7.2.3 Symptoms of erythrophobia. The fear of blushing can trigger a range of physical, emotional, and cognitive symptoms. These symptoms may vary in intensity depending on the individual and the specific situation. Common symptoms of erythrophobia include physical symptoms: rapid heartbeat, shortness of breath, sweating, trembling or shaking, nausea or stomach discomfort, dizziness or lightheadedness. Emotional symptoms: intense anxiety or panic, feelings of embarrassment or shame, fear of being judged or ridiculed, overwhelming self-consciousness, avoidance of social situations. Cognitive symptoms: persistent worry about blushing, negative self-talk and self-criticism, catastrophic thinking, e.g., imagining the worst-case scenarios, difficulty concentrating or focusing on tasks, impaired decision-making. 7.2.4 Treatment for erythrophobia. Fortunately, erythrophobia is a treatable condition, and individuals can overcome their fear of blushing with the help of various therapeutic approaches. Some common treatment options include cognitive behavioral therapy, CBT. CBT is a widely used and effective treatment for phobias. It helps individuals identify and challenge their negative thoughts and beliefs about blushing. Through gradual exposure and systematic desensitization, individuals learn to confront their fear and develop healthier coping strategies. Exposure therapy. Exposure therapy involves gradually exposing individuals to situations that trigger blushing in a controlled and supportive environment. By repeatedly facing their fear, individuals can learn that blushing is not as catastrophic as they perceive it to be. This process helps to reduce anxiety and desensitize the fear response. Relaxation techniques. Learning relaxation techniques, such as deep breathing, progressive muscle relaxation, and mindfulness meditation, can help individuals manage their anxiety symptoms. These techniques can be used as coping mechanisms during situations that may trigger blushing. Medication. In some cases, medication may be prescribed to help manage the symptoms of arachnophobia. Antidepressants or anti-anxiety medications may be used to reduce anxiety and improve overall well-being. However, medication is typically used in conjunction with therapy and should be monitored by a healthcare professional. 7.2.5 Coping Strategies for Arachnophobia. In addition to professional treatment, there are several self-help strategies that individuals with arachnophobia can practice to cope with their fear of blushing. Education and self-awareness. Learning about arachnophobia and understanding its causes can help individuals gain insight into their fear. Self-awareness can also help individuals identify triggers and develop strategies to manage their anxiety. Challenge negative thoughts. Practice challenging negative thoughts and beliefs about blushing. Replace self-critical thoughts with more realistic and positive ones. Remind yourself that blushing is a natural physiological response and does not define your worth or competence. Practice relaxation techniques. Regularly engage in relaxation techniques to reduce overall anxiety levels. Deep breathing exercises, progressive muscle relaxation, and mindfulness meditation can help calm the mind and body. Gradual exposure. Gradually expose yourself to situations that trigger blushing. Start with less challenging situations and gradually work your way up to more anxiety-provoking scenarios. Each successful exposure will build your confidence and reduce the fear response. Seek support. Reach out to friends, family, or support groups who can provide understanding and encouragement. Sharing your experiences with others who have similar fears can be comforting and empowering. Remember, overcoming arachnophobia takes time and patience. With the right support and treatment, individuals can learn to manage their fear of blushing and regain control over their lives. 7.3 Thanatophobia, Fear of Death. Thanatophobia, also known as the fear of death, is a common and deeply rooted phobia that affects many individuals. It is a complex and multifaceted fear that can manifest in different ways for different people. While it is natural to have some level of fear or anxiety about death, thanatophobia is characterized by an intense and irrational fear that can significantly impact a person's daily life and overall well-being. 7.3.1 Understanding Thanatophobia. Thanatophobia is rooted in the fear of the unknown and the uncertainty surrounding death. It is often associated with existential questions about the meaning of life and what happens after death. People with thanatophobia may experience intrusive thoughts and worries about their own mortality or the mortality of their loved ones. They may constantly dwell on the idea of death and find it difficult to cope with the inevitability of mortality. 7.3.2 Causes of Thanatophobia. The exact causes of thanatophobia are not fully understood, but it is believed to be influenced by a combination of genetic, environmental, and psychological factors. Some individuals may develop thanatophobia after experiencing a traumatic event or the loss of a loved one. Others may develop the fear as a result of cultural or religious beliefs surrounding death. Additionally, individuals with a history of anxiety disorders or other phobias may be more prone to developing thanatophobia. 7.3.3 Symptoms of Thanatophobia. The symptoms of thanatophobia can vary from person to person, but commonly include intense anxiety or panic attacks when thinking about death or dying, avoidance of situations or discussions related to death, obsessive thoughts about death and dying, difficulty sleeping or nightmares related to death. Physical symptoms such as rapid heartbeat, sweating, and shortness of breath when confronted with the fear of death. Social withdrawal and isolation due to the fear of mortality. 7.3.4 Coping with Thanatophobia. Living with thanatophobia can be challenging, but there are strategies and techniques that can help individuals cope with their fear of death. Here are some approaches that may be beneficial. 7.3.4.1 Education and Understanding. One of the first steps in coping with thanatophobia is to educate oneself about death and dying. Learning about the natural process of death, different cultural beliefs, and philosophical perspectives can help demystify the fear and provide a sense of understanding and acceptance. 7.3.4.2 Therapy and Counseling. Seeking professional help from a therapist or counselor who specializes in anxiety disorders and phobias can be highly beneficial for individuals with thanatophobia. Cognitive behavioral therapy, CBT, and exposure therapy are commonly used techniques to help individuals gradually confront and overcome their fear of death. 7.3.4.3 Mindfulness and Meditation. Practicing mindfulness and meditation techniques can help individuals with thanatophobia develop a sense of presence and acceptance. By focusing on the present moment and cultivating a non-judgmental attitude towards their fear, individuals can learn to manage their anxiety and reduce the impact of thanatophobia on their daily lives. 7.3.4.4 Support Systems. Building a strong support system of friends, family, or support groups can provide individuals with thanatophobia a safe space to express their fears and concerns. Sharing experiences and connecting with others who have similar fears can help individuals feel less alone and provide a sense of validation and understanding. 7.3.4.5 Self-care strategies. Engaging in self-care activities can help individuals with thanatophobia manage their anxiety and improve their overall well-being. Regular exercise, maintaining a healthy diet, getting enough sleep, and practicing relaxation techniques such as deep breathing or progressive muscle relaxation can all contribute to reducing anxiety and promoting a sense of calm. 7.3.5 Overcoming thanatophobia. While overcoming thanatophobia may be a gradual process, it is possible to reduce the impact of the fear and live a fulfilling life. Here are some strategies that can aid in overcoming thanatophobia. 7.3.5.1 Exposure therapy. Exposure therapy involves gradually exposing oneself to situations or thoughts related to death in a controlled and supportive environment. By gradually facing their fear, individuals can learn to tolerate and manage their anxiety, ultimately reducing the impact of thanatophobia on their daily lives. 7.3.5.2 Cognitive restructuring. Cognitive restructuring involves challenging and replacing negative thoughts and beliefs about death with more rational and positive ones. By reframing their perspective, individuals can develop a healthier and more balanced view of death, reducing the intensity of their fear. 7.3.5.3 Seeking professional help. If thanatophobia significantly impacts an individual's daily life and well-being, it is important to seek professional help. A mental health professional can provide guidance, support, and evidence-based treatments to help individuals overcome their fear of death. 7.3.5.4 Celebrating life. Focusing on celebrating and embracing life can be a powerful way to counteract the fear of death. Engaging in activities that bring joy, pursuing meaningful relationships, and setting and achieving personal goals can all contribute to a sense of fulfillment and purpose, helping individuals shift their focus away from their fear. In conclusion, thanatophobia, or the fear of death, is a complex phobia that can significantly impact an individual's life. However, with the right support, coping strategies, and professional help, individuals can learn to manage and overcome their fear, allowing them to live a more fulfilling and meaningful life. 7.4 Glossophobia, fear of public speaking. Glossophobia, also known as the fear of public speaking, is one of the most common phobias that people experience. It is estimated that up to 75% of individuals have some level of anxiety or fear when it comes to speaking in front of a group of people. This fear can range from mild nervousness to extreme panic and can have a significant impact on a person's personal and professional life. 7.4.1 Understanding glossophobia. Glossophobia is often rooted in a fear of being judged or criticized by others. The fear of public speaking can be triggered by various factors, including past negative experiences, low self-esteem, lack of confidence, or a fear of making mistakes in front of others. Individuals with glossophobia may also fear forgetting their lines or being unable to articulate their thoughts effectively. 7.4.2 Symptoms of glossophobia. The symptoms of glossophobia can vary from person to person, but common signs include intense anxiety or panic attacks before or during a speaking engagement, rapid heartbeat, sweating, and trembling, dry mouth and difficulty swallowing, nausea or stomach discomfort, feeling lightheaded or dizzy, avoidance of public speaking situations, negative thoughts and self-doubt, difficulty concentrating or remembering information. 7.4.3 Causes of glossophobia. Glossophobia can develop due to a combination of genetic, environmental, and psychological factors. Some possible causes include traumatic experiences. A negative experience in the past, such as being humiliated or embarrassed while speaking in public, can contribute to the development of glossophobia. Learned behavior. Observing others who struggle with public speaking or receiving negative feedback from peers or authority figures can create a fear response. Social anxiety. Glossophobia is often associated with social anxiety disorder, which is characterized by an intense fear of social situations. Perfectionism. Individuals with high levels of perfectionism may fear making mistakes or being judged by others, leading to a fear of public speaking. Lack of experience. Limited exposure to public speaking opportunities can contribute to the development of glossophobia. 7.4.4 Coping strategies for glossophobia. While glossophobia can be challenging to overcome, there are several strategies that can help individuals manage their fear and improve their public speaking skills. Preparation. Adequate preparation is key to reducing anxiety. Practice your speech or presentation multiple times, familiarize yourself with the content, and anticipate potential questions or challenges. Deep breathing and relaxation techniques. Deep breathing exercises and relaxation techniques, such as progressive muscle relaxation or meditation, can help calm the body and mind before a speaking engagement. Positive self-talk. Replace negative thoughts with positive affirmations. Remind yourself of your strengths and past successes in public speaking. Gradual exposure. Gradually expose yourself to public speaking situations. Start with smaller, less intimidating audiences and gradually work your way up to larger groups. Seek support. Join a public speaking group or take a public speaking course to gain support and feedback from others who share similar fears. Working with a therapist or counselor can also be beneficial in addressing underlying anxiety or self-esteem issues. Visualize success. Use visualization techniques to imagine yourself delivering a successful speech or presentation. Visualize the positive reactions from the audience and the feeling of accomplishment. Focus on the message. Shift your focus from yourself to the message you want to convey. Remember that the audience is there to listen and learn from you, not to judge or criticize. Celebrate progress. Acknowledge and celebrate your achievements, no matter how small. Each successful speaking engagement is a step forward in overcoming glossophobia. 7.4.5 Professional help for glossophobia. In severe cases of glossophobia, seeking professional help may be necessary. A mental health professional, such as a therapist or psychologist, can provide specialized treatment options, including cognitive behavioral therapy, CBT, or exposure therapy. These therapeutic approaches aim to identify and challenge negative thought patterns, gradually desensitize individuals to public speaking situations, and build confidence and coping skills. Remember, overcoming glossophobia takes time and practice. With persistence and the right support, individuals can learn to manage their fear and become more confident and effective public speakers. 8. Psychological phobias. 8.1 Phobophobia, fear of phobias. Phobophobia, also known as fear of phobias, is a unique and intriguing psychological condition that involves an intense and irrational fear of developing a phobia. Individuals with phobophobia experience extreme anxiety and distress at the mere thought of developing a specific phobia or any type of fear. This fear can be so overwhelming that it can significantly impact their daily lives and overall well-being. 8.1.1 Understanding phobophobia. Phobophobia is classified as an anxiety disorder and falls under the category of specific phobias. While most phobias are characterized by a fear of specific objects or situations, phobophobia is characterized by a fear of developing a phobia itself. This fear can be triggered by various factors, such as witnessing someone else's phobia or experiencing a traumatic event related to phobias. Individuals with phobophobia often have a heightened sense of awareness and anticipation of fear. They may constantly worry about encountering situations or objects that could potentially trigger a phobia. This fear can lead to avoidance behaviors, where individuals go to great lengths to avoid any situation that may cause them to develop a phobia. 8.1.2 Causes of phobophobia. The exact causes of phobophobia are not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some possible causes include traumatic experiences. Individuals who have experienced a traumatic event related to phobias, such as witnessing a loved one's extreme fear of going through a distressing situation themselves, may develop phobophobia as a way to protect themselves from similar experiences in the future. Learned behavior. Phobophobia can also be learned through observation. If a person grows up in an environment where phobias are highly feared, or if they witness someone close to them struggling with a phobia, they may develop a fear of developing phobias themselves. Genetic predisposition. There may be a genetic component to phobophobia, as individuals with a family history of anxiety disorders or specific phobias may be more prone to developing phobophobia. Anxiety and stress. Generalized anxiety and high levels of stress can contribute to the development of phobophobia. The constant worry and fear associated with anxiety disorders can make individuals more susceptible to developing a fear of phobias. 8.1.3 Symptoms of phobophobia. Phobophobia can manifest in various ways, and the symptoms can vary from person to person. Some common symptoms of phobophobia include intense anxiety or panic attacks when thinking about or encountering situations that could potentially lead to developing a phobia. Avoidance behaviors, such as avoiding situations, places, or objects that may trigger a phobia. Excessive worry and fear about developing a phobia. Physical symptoms, such as rapid heartbeat, sweating, trembling, shortness of breath, and nausea. Difficulty concentrating or focusing on tasks due to preoccupation with the fear of phobias. Sleep disturbances, such as insomnia or nightmares related to phobias. Social isolation and withdrawal from activities or relationships due to the fear of encountering situations that may lead to developing a phobia. It is important to note that phobophobia can significantly impact an individual's quality of life and may coexist with other anxiety disorders or mental health conditions. 8.1.4 Treatment for phobophobia. Phobophobia, like other anxiety disorders, can be effectively treated with various therapeutic approaches. The goal of treatment is to help individuals manage their fear and anxiety surrounding the development of phobias. Some common treatment options include cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach for treating phobias and anxiety disorders. It helps individuals identify and challenge their irrational thoughts and beliefs about phobias, gradually exposing them to their fears in a controlled and safe environment. Exposure therapy. Exposure therapy is a specific type of CBT that involves gradually exposing individuals to their feared situations or objects. This gradual exposure helps individuals confront their fears and learn that their anxiety will decrease over time. Relaxation techniques. Learning relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, and mindfulness meditation, can help individuals manage their anxiety and reduce the fear associated with phobophobia. Medication. In some cases, medication may be prescribed to help manage the symptoms of phobophobia. Antidepressants or anti-anxiety medications may be used to reduce anxiety and improve overall well-being. Support groups. Joining support groups or therapy groups with individuals who have similar experiences can provide a sense of understanding, validation, and support. Sharing experiences and coping strategies with others can be beneficial in managing phobophobia. It is important for individuals with phobophobia to seek professional help from mental health professionals who specialize in anxiety disorders. With the right treatment and support, individuals can learn to manage their fear of phobias and regain control over their lives. 8.2 Pteromerhanophobia, fear of flying. Pteromerhanophobia, also known as aviophobia or aerophobia, is the fear of flying. It is a specific phobia that affects a significant number of individuals worldwide. People with this phobia experience intense anxiety and fear when they are in an airplane or even at the thought of flying. This fear can be debilitating and can significantly impact their personal and professional lives. 8.2.1 Understanding Pteromerhanophobia. Pteromerhanophobia is often rooted in various factors, including past traumatic experiences, fear of heights, fear of enclosed spaces, fear of losing control, or fear of crashes. It can also be influenced by media portrayals of airplane accidents or stories of turbulence and mishaps. Individuals with this phobia may have a heightened sense of danger and a lack of trust in the safety measures of air travel. 8.2.2 Symptoms of Pteromerhanophobia. The symptoms of pteromerhanophobia can vary in intensity from person to person. Some common symptoms include intense anxiety. Individuals with pteromerhanophobia may experience extreme anxiety and panic attacks when faced with the prospect of flying. This anxiety can manifest as a racing heart, shortness of breath, trembling, sweating, and a sense of impending doom. Avoidance behaviors. Many individuals with pteromerhanophobia will go to great lengths to avoid flying altogether. They may cancel trips, choose alternative modes of transportation, or even turn down job opportunities that require air travel. Physical discomfort. The fear of flying can also lead to physical discomfort, such as headaches, stomachaches, nausea, dizziness, and muscle tension. Cognitive symptoms. Individuals with pteromerhanophobia may experience intrusive thoughts about plane crashes, turbulence, or other catastrophic events. They may also have difficulty concentrating or thinking clearly when faced with the prospect of flying. Emotional distress. Pteromerhanophobia can cause significant emotional distress, including feelings of fear, helplessness, and a sense of being out of control. Individuals may also feel embarrassed or ashamed of their fear, leading to social isolation. 8.2.3 Causes of Pteromerhanophobia. The fear of flying can stem from various causes, including traumatic experiences. A past traumatic experience related to flying, such as a turbulent flight or witnessing an airplane accident, can trigger pteromerhanophobia. The individual may associate flying with danger and fear based on their personal experience. Learned behavior. Pteromerhanophobia can also be learned from observing others' fear or hearing stories of negative flying experiences. If a close family member or friend has a fear of flying, it can influence an individual to develop the same fear. Underlying anxiety disorders. Pteromerhanophobia can be a symptom of an underlying anxiety disorder, such as generalized anxiety disorder or panic disorder. Individuals with these disorders may have a heightened sensitivity to fear and experience anxiety in various situations, including flying. Fear of losing control. Flying involves surrendering control to the pilot and the aircraft. Individuals who have a fear of losing control in any situation may find it particularly challenging to cope with the lack of control during a flight. 8.2.4 Treatment for Pteromerhanophobia. Fortunately, pteromerhanophobia is a treatable condition, and individuals can overcome their fear of flying with the help of various therapeutic approaches. Some common treatment options include cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach for treating phobias. It involves identifying and challenging negative thoughts and beliefs related to flying and replacing them with more rational and positive ones. CBT also includes gradual exposure to flying-related stimuli to desensitize individuals to their fear. Exposure therapy. Exposure therapy involves gradually exposing individuals to their fear of flying in a controlled and supportive environment. This can be done through virtual reality simulations, guided imagery, or actual flights with the guidance of a therapist. The goal is to help individuals confront their fear and learn coping strategies to manage their anxiety. Medication. In some cases, medication may be prescribed to help manage the symptoms of pteromerhanophobia. Anti-anxiety medications or beta blockers can be used to reduce anxiety and physical symptoms associated with flying. Relaxation techniques. Learning relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, and mindfulness meditation, can help individuals manage their anxiety and promote a sense of calmness during flights. 8.2.5 Self-help strategies for pteromerhanophobia. In addition to professional treatment, individuals with pteromerhanophobia can also practice self-help strategies to cope with their fear of flying. Some helpful strategies include education and knowledge. Learning about the safety measures and statistics related to air travel can help individuals challenge their irrational fears and gain a sense of control and reassurance. Preparation and distraction. Engaging in activities that distract the mind, such as reading a book, listening to music, or watching a movie, can help individuals divert their attention from their fear during a flight. Being prepared with comforting items, such as a favorite blanket or a stress ball, can also provide a sense of security. Breathing exercises. Deep breathing exercises can help individuals regulate their breathing and reduce anxiety during a flight. Taking slow, deep breaths in through the nose and exhaling slowly through the mouth can promote relaxation and calmness. Positive self-talk. Practicing positive affirmations and self-talk can help individuals challenge negative thoughts and replace them with more positive and rational ones. Reminding oneself of the safety measures in place and focusing on the excitement of reaching the destination can help shift the mindset from fear to positivity. By seeking professional help and implementing self-help strategies, individuals with arachnophobia can gradually overcome their fear of flying and regain control over their lives. It is important to remember that overcoming this fear takes time and patience, but with the right support and determination, individuals can conquer their fear and experience the freedom of air travel. 8.3 Agoraphobia. Agoraphobia is a specific phobia characterized by an intense fear and avoidance of situations or places where escape might be difficult or embarrassing, or where help may not be readily available in the event of a panic attack or other distressing symptoms. People with agoraphobia often fear being in crowded places, open spaces, using public transportation, or being outside of their home alone. This fear can be so severe that it can significantly impact their daily lives and limit their ability to engage in normal activities. 8.3.1 Understanding agoraphobia. Agoraphobia is often misunderstood and can be challenging to overcome. It is important to recognize that agoraphobia is not simply a fear of open spaces or crowded places. It is a complex anxiety disorder that involves a fear of experiencing panic attacks or other distressing symptoms in situations where escape may be difficult or help may not be readily available. The fear of having a panic attack is a central aspect of agoraphobia. Individuals with agoraphobia often worry about losing control, embarrassing themselves, or being judged by others if they were to have a panic attack in public. As a result, they may avoid situations or places that they perceive as potentially triggering a panic attack. 8.3.2 Causes of agoraphobia. The exact cause of agoraphobia is unknown, but it is believed to be a combination of genetic, environmental, and psychological factors. Some individuals may be more predisposed to developing agoraphobia due to a family history of anxiety disorders. Traumatic experiences, such as a history of panic attacks or other anxiety disorders, may also contribute to the development of agoraphobia. Additionally, individuals with agoraphobia may have certain personality traits, such as being more prone to anxiety or having a tendency to avoid challenging situations. These factors, combined with a triggering event or experience, can lead to the development of agoraphobia. 8.3.3 Symptoms of agoraphobia. The symptoms of agoraphobia can vary from person to person, but they generally involve intense anxiety and fear in certain situations. Some common symptoms of agoraphobia include panic attacks. Individuals with agoraphobia may experience recurrent panic attacks, which are sudden episodes of intense fear or discomfort. These panic attacks can be accompanied by physical symptoms such as rapid heartbeat, shortness of breath, dizziness, sweating, and trembling. Avoidance behavior. People with agoraphobia often go to great lengths to avoid situations or places that they fear may trigger a panic attack. This can include avoiding crowded places, public transportation, or even leaving their home altogether. Fear of being alone. Many individuals with agoraphobia also have a fear of being alone, as they worry that they may experience a panic attack without anyone there to help or support them. Feelings of helplessness or embarrassment. Individuals with agoraphobia may feel helpless or embarrassed about their fear and avoidance behaviors. They may also worry about being judged by others or being seen as weak or incapable. 8.3.4 Treatment for agoraphobia. Agoraphobia can be a debilitating condition, but it is treatable with the right approach. Treatment for agoraphobia often involves a combination of therapy, medication, and self-help strategies. Here are some common treatment options. Cognitive behavioral therapy, CBT. CBT is a type of therapy that helps individuals identify and change negative thought patterns and behaviors. It can help individuals with agoraphobia challenge their fears and develop coping strategies to gradually face and overcome their anxiety. Exposure therapy. Exposure therapy is a specific type of CBT that involves gradually exposing individuals to the situations or places they fear in a controlled and supportive environment. This helps them build confidence and reduce their anxiety over time. Medication. In some cases, medication may be prescribed to help manage the symptoms of agoraphobia. Antidepressants and anti-anxiety medications are commonly used to reduce anxiety and panic symptoms. Self-help strategies. There are several self-help strategies that individuals with agoraphobia can practice to manage their symptoms. These include deep breathing exercises, relaxation techniques, and gradually exposing themselves to feared situations in a step-by-step manner. It is important for individuals with agoraphobia to seek professional help and support. With the right treatment and support, many people with agoraphobia are able to overcome their fears and lead fulfilling lives. Remember, recovery is possible, and there is hope for a brighter future. 8.4 Autophobia. Fear of being alone. Autophobia, also known as monophobia, is the intense fear or anxiety of being alone. Individuals with autophobia often experience extreme distress and discomfort when they find themselves in situations where they are without the presence of others. This fear can manifest in different ways, ranging from mild unease to debilitating panic attacks. 8.4.1 Understanding autophobia. Autophobia is a psychological phobia that can develop due to various factors, including traumatic experiences, childhood experiences, or a predisposition to anxiety disorders. It is important to note that autophobia is different from introversion or a preference for solitude. Autophobia is characterized by an irrational and overwhelming fear of being alone, which can significantly impact an individual's daily life and overall well-being. 8.4.2 Causes of autophobia. The exact causes of autophobia are not fully understood, but several factors may contribute to its development. Traumatic experiences, such as being abandoned or isolated during childhood, can trigger autophobia. Other factors may include a history of anxiety disorders, a genetic predisposition to anxiety, or a learned fear response from observing others' reactions to being alone. 8.4.3 Symptoms of autophobia. Individuals with autophobia may experience a range of physical, emotional, and cognitive symptoms when faced with the prospect of being alone. These symptoms can vary in intensity and may include physical symptoms: rapid heartbeat, shortness of breath, sweating, trembling or shaking, nausea or stomach discomfort. Emotional symptoms: intense fear or anxiety, overwhelming sense of dread, feeling of impending doom, restlessness or irritability, panic attacks. Cognitive symptoms: persistent thoughts of danger or harm, difficulty concentrating, negative self-talk or self-doubt, fear of losing control, hypervigilance to potential threats. 8.4.4 Coping strategies for autophobia. While autophobia can be challenging to overcome, there are several coping strategies that individuals can employ to manage their fear of being alone. Seeking professional help. Consulting with a mental health professional, such as a therapist or counselor, can provide valuable support and guidance in understanding and managing autophobia. They can help identify the underlying causes and develop personalized treatment plans. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach that focuses on identifying and challenging negative thought patterns and beliefs. Through CBT, individuals can learn to reframe their thoughts about being alone and develop healthier coping mechanisms. Gradual exposure. Gradually exposing oneself to being alone can help desensitize the fear response. Starting with short periods of solitude and gradually increasing the duration can help individuals build confidence and reduce anxiety. Relaxation techniques. Practicing relaxation techniques, such as deep breathing, meditation, or progressive muscle relaxation, can help individuals manage anxiety symptoms associated with autophobia. These techniques promote a sense of calm and can be used during moments of distress. Building a support system. Surrounding oneself with supportive and understanding individuals can provide a sense of security and comfort. Sharing fears and concerns with trusted friends or family members can help alleviate anxiety related to being alone. Self-care strategies. Engaging in self-care activities, such as exercise, hobbies, or mindfulness practices, can help individuals cultivate a sense of well-being and self-confidence. Taking care of one's physical and emotional needs can contribute to overall resilience in managing autophobia. Positive affirmations. Practicing positive affirmations can help individuals challenge negative self-talk and build self-esteem. Repeating affirmations such as, "I am capable of being alone," or, "I am safe and secure in my own company," can gradually shift the perception of being alone from a threat to a manageable situation. Celebrating progress. Recognizing and celebrating small victories along the journey of overcoming autophobia can boost motivation and self-confidence. Each step taken towards facing and managing the fear of being alone is an achievement worth acknowledging. Remember, overcoming autophobia takes time and patience. It is essential to be kind to oneself throughout the process and seek professional help when needed. With the right support and strategies, individuals can gradually reduce their fear of being alone and regain a sense of control over their lives. 9. Childhood phobias. 9.1 Separation anxiety disorder. Separation anxiety disorder is a specific type of childhood phobia that is characterized by excessive fear or anxiety when a child is separated from their primary caregiver or loved ones. It is a common and normal part of development for infants and toddlers to experience some level of distress when separated from their parents or caregivers. However, when this fear and anxiety persist beyond a certain age and interfere with the child's daily life and functioning, it may be diagnosed as separation anxiety disorder. 9.1.1 Understanding separation anxiety disorder. Separation anxiety disorder typically begins in early childhood, around the age of 6 to 7 years, but it can also develop in older children and adolescents. The fear and anxiety associated with this disorder are often triggered by the anticipation or actual separation from the primary caregiver, such as going to school, being left with a babysitter, or even sleeping alone in their own room. The child may exhibit excessive distress, worry, and fear about being separated from their loved ones, which can manifest through physical symptoms like headaches, stomach aches, and difficulty sleeping. 9.1.2 Causes of separation anxiety disorder. The exact causes of separation anxiety disorder are not fully understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some children may be more prone to developing this disorder due to their temperament or a family history of anxiety disorders. Additionally, major life changes such as moving to a new home, starting a new school, or the loss of a loved one can trigger or exacerbate separation anxiety in children. 9.1.3 Symptoms of separation anxiety disorder. Children with separation anxiety disorder may exhibit a range of symptoms, both emotional and physical, when faced with separation from their primary caregiver. These symptoms can include excessive distress or worry about being separated from loved ones, refusal to go to school or other places where separation is required, reluctance or refusal to sleep alone or away from the primary caregiver, nightmares or fear of sleeping alone, physical symptoms such as headaches, stomach aches, and nausea, clinging behavior and excessive need for reassurance, fear of something bad happening to the primary caregiver while they are separated. Difficulty concentrating or focusing on tasks due to preoccupation with separation. 9.1.4 Diagnosis and treatment of separation anxiety disorder. If you suspect that your child may be experiencing separation anxiety disorder, it is important to consult with a mental health professional who specializes in child and adolescent psychology. The diagnosis is typically made based on a thorough assessment of the child's symptoms, history, and observation of their behavior in various settings. Treatment for separation anxiety disorder often involves a combination of therapy and support from parents and caregivers. Cognitive behavioral therapy, CBT, is commonly used to help children identify and challenge their anxious thoughts and develop coping strategies to manage their fears. The therapist may also work with the child and their family to gradually expose them to situations that trigger anxiety, helping them build resilience and confidence over time. In some cases, medication may be prescribed to help manage the symptoms of separation anxiety disorder, particularly if the anxiety is severe and significantly impacting the child's daily life. However, medication is typically used as a last resort and is always combined with therapy and parental support. 9.1.5 Coping strategies for parents and caregivers. As a parent or caregiver of a child with separation anxiety disorder, it can be challenging to witness your child's distress and worry. However, there are several strategies that can help support your child through this difficult time. Establish a consistent routine. Having a predictable schedule can provide a sense of security and stability for your child. Encourage independence. Gradually encourage your child to engage in activities that involve separation, such as playdates or sleepovers, while providing reassurance and support. Validate their feelings. Let your child know that their fears and worries are valid and that you understand their anxiety. Offer empathy and reassurance without dismissing their concerns. Practice relaxation techniques. Teach your child relaxation techniques such as deep breathing or visualization exercises to help them manage their anxiety. Communicate with their school. Inform your child's teachers and school staff about their separation anxiety so that they can provide appropriate support and understanding. Seek support for yourself. Taking care of a child with separation anxiety disorder can be emotionally draining. Reach out to support groups or seek therapy for yourself to help manage your own stress and anxiety. Remember, with patience, understanding, and the right support, children with separation anxiety disorder can learn to manage their fears and lead fulfilling lives. 9.2 School phobia. School phobia, also known as school refusal or school avoidance, is a specific childhood phobia that involves an intense fear or anxiety about attending school. Children with school phobia often experience extreme distress and may go to great lengths to avoid going to school. This fear can have a significant impact on their academic, social, and emotional development. 9.2.1 Understanding school phobia. School phobia is more than just a dislike or reluctance to go to school. It is characterized by extreme fear and anxiety that can lead to physical symptoms such as stomach aches, headaches, and even panic attacks. The fear is often irrational and disproportionate to the actual threat posed by attending school. Children with school phobia may have a variety of reasons for their fear. Some common triggers include separation anxiety, social anxiety, bullying, academic pressure, or traumatic experiences at school. It is important to note that school phobia is not the same as truancy, where children skip school without any fear or anxiety. 9.2.2 Signs and symptoms. Recognizing the signs and symptoms of school phobia is crucial for early intervention and support. Some common signs include physical symptoms. Children may complain of stomach aches, headaches, nausea, or other physical discomforts when it is time to go to school. These symptoms may disappear when the child is allowed to stay home. Emotional distress. Children with school phobia may exhibit extreme distress, crying, tantrums, or clinginess when faced with the prospect of going to school. They may also express fear or worry about specific aspects of school, such as tests, bullies, or social interactions. Avoidance behaviors. Children may try to avoid going to school by feigning illness, refusing to get ready for school, or throwing tantrums. They may also exhibit avoidance behaviors such as hiding, running away, or pleading with parents to let them stay home. Academic decline. School phobia can have a significant impact on a child's academic performance. They may start to fall behind in their schoolwork, miss important assignments or tests, or show a sudden decline in grades. Social withdrawal. Children with school phobia may become socially isolated and withdraw from their friends and peers. They may avoid social activities or refuse invitations to playdates or parties. 9.2.3 Causes and risk factors. The exact causes of school phobia are not fully understood, but several factors may contribute to its development. These include separation anxiety. School phobia often occurs in children who have difficulty separating from their parents or caregivers. They may fear being away from their loved ones and worry about their safety or well-being. Traumatic experiences. A traumatic event at school, such as bullying, a humiliating experience, or a negative interaction with a teacher, can trigger school phobia. The fear of a similar event happening again can lead to avoidance behaviors. Social anxiety. Children who struggle with social interactions and have a fear of being judged or rejected by their peers may develop school phobia. The fear of embarrassment or humiliation can make attending school a source of extreme anxiety. Academic pressure. High expectations, academic difficulties, or a fear of failure can contribute to school phobia. Children may feel overwhelmed by the demands of school and develop a fear of not meeting expectations. Family factors. Family dynamics, such as overprotective parenting, excessive reassurance-seeking behaviors, or a history of anxiety disorders, can increase the risk of school phobia. 9.2.4 Treatment and support. Addressing school phobia requires a comprehensive approach that involves collaboration between parents, school personnel, and mental health professionals. The goal is to help the child overcome their fear and anxiety and reintegrate into the school environment. Some common treatment strategies include cognitive behavioral therapy, CBT. CBT is a highly effective treatment for school phobia. It helps children identify and challenge their irrational thoughts and beliefs about school. They learn coping skills to manage their anxiety and gradually expose themselves to feared situations. Gradual exposure. Gradual exposure involves gradually increasing the child's exposure to the feared situation, such as attending school for short periods initially and gradually increasing the duration. This approach helps the child build confidence and reduces their anxiety over time. Parental support and involvement. Parents play a crucial role in supporting their child through school phobia. They can provide reassurance, establish a consistent routine, and work closely with school personnel to create a supportive and understanding environment. School accommodations. Schools can make accommodations to support children with school phobia. This may include providing a designated safe space, allowing breaks during the school day, or implementing a gradual reintegration plan. Social skills training. Children with school phobia may benefit from social skills training to improve their confidence and ability to navigate social interactions. This can help reduce their fear of judgment or rejection by peers. 9.2.5 Prevention strategies. While it may not be possible to prevent school phobia entirely, there are some strategies that can help reduce the risk or severity of the condition. Promote a positive school environment. Schools should foster a positive and inclusive environment where students feel safe, supported, and valued. Implementing anti-bullying programs and providing resources for mental health support can contribute to a positive school climate. Open communication. Encourage open communication between parents, teachers, and students. Regularly check in with children about their feelings and experiences at school. Address any concerns or issues promptly to prevent them from escalating. Normalize anxiety. Help children understand that it is normal to feel anxious or nervous about certain situations, including going to school. Teach them coping strategies to manage their anxiety and provide reassurance that they are not alone in their fears. Gradual transitions. When starting school or transitioning to a new grade, gradually introduce the child to the new environment. Arrange visits to the school, meet the teachers, and familiarize them with the routines and expectations. Encourage resilience. Foster resilience in children by teaching them problem-solving skills, building their self-esteem, and promoting a growth mindset. Resilient children are better equipped to cope with challenges and setbacks, including school-related fears and anxieties. By understanding and addressing school phobia early on, parents, educators, and mental health professionals can provide the necessary support and interventions to help children overcome their fears and thrive academically and emotionally. 9.3 Fear of the dark. Fear of the dark, also known as agoraphobia or arachnophobia, is a common childhood phobia that can persist into adulthood. It is characterized by an intense and irrational fear of darkness or the absence of light. This fear can be triggered by various factors, such as a traumatic experience, cultural beliefs, or a lack of understanding about the dark. 9.3.1 Understanding fear of the dark. Fear of the dark is a natural response that has evolved as a survival mechanism. In the past, when humans lived in a more dangerous environment, darkness posed a greater threat. Our ancestors had to be cautious of predators and other dangers that lurked in the dark. This fear is deeply ingrained in our subconscious, and for some individuals, it can become exaggerated and irrational. 9.3.2 Causes of fear of the dark. The fear of the dark can stem from various causes, including imagination and perception. Children have vivid imaginations, and their perception of the dark can be influenced by stories, movies, or even their own thoughts. They may imagine monsters, ghosts, or other frightening creatures hiding in the darkness. Traumatic experience. A traumatic event that occurred in the dark, such as being trapped in a dark room or experiencing a power outage, can trigger a fear response. The individual may associate darkness with danger and develop a phobia as a result. Lack of understanding. Young children may not fully understand the concept of darkness and may feel anxious or scared when they cannot see what is around them. This fear can persist if not addressed or if the child's concerns are dismissed. Cultural and religious beliefs. Some cultures or religions associate darkness with evil or negative forces. Children growing up in such environments may develop a fear of the dark due to these beliefs. 9.3.3 Symptoms of fear of the dark. The fear of the dark can manifest in various ways, and the severity of symptoms can vary from person to person. Common symptoms include anxiety and panic. Individuals with a fear of the dark may experience intense anxiety or panic attacks when exposed to darkness or even the thought of darkness. Avoidance behavior. People with this phobia may go to great lengths to avoid situations or places that involve darkness. They may refuse to enter dark rooms, sleep with lights on, or avoid outdoor activities at night. Physical symptoms. Physical manifestations of fear can include rapid heartbeat, sweating, trembling, shortness of breath, nausea, and a feeling of impending doom. Sleep disturbances. Fear of the dark can disrupt sleep patterns, leading to insomnia or nightmares. Individuals may have difficulty falling asleep or staying asleep in the absence of light. Hyperawareness. Some individuals with this phobia may become hyperaware of their surroundings in the dark, constantly scanning for potential threats. This heightened state of alertness can be exhausting and contribute to anxiety. 9.3.4 Coping Strategies for Fear of the Dark. If you or someone you know struggles with a fear of the dark, there are several coping strategies that can help. Education and exposure. Understanding that darkness is a natural phenomenon and not inherently dangerous can help alleviate fear. Gradual exposure to darkness in a controlled and safe environment can also desensitize individuals to their fear. Nightlights and comfort objects. Using nightlights or having a comforting object, such as a stuffed animal or a favorite blanket, can provide a sense of security and reduce anxiety. Relaxation techniques. Practicing relaxation techniques, such as deep breathing, meditation, or progressive muscle relaxation, can help calm the mind and body during moments of fear or anxiety. Positive reinforcement. Encouraging positive self-talk and rewarding oneself for facing fears can be effective in overcoming the fear of the dark. Celebrating small victories and progress can boost confidence and motivation. Seeking professional help. If the fear of the dark significantly impacts daily life or causes distress, it may be beneficial to seek the guidance of a mental health professional. They can provide specialized therapies, such as cognitive behavioral therapy, CBT, to address and overcome the phobia. Remember, overcoming the fear of the dark takes time and patience. With the right support and strategies, it is possible to gradually reduce anxiety and regain a sense of control in the presence of darkness. 9.4 Specific childhood phobias. Children, like adults, can experience a wide range of fears and anxieties. While some fears are considered normal and age-appropriate, others may develop into specific childhood phobias. These phobias are characterized by an intense and irrational fear of a specific object, situation, or event. In this section, we will explore some common specific childhood phobias and discuss their causes, symptoms, and potential treatment options. 9.4.1 Fear of the dark. Fear of the dark, also known as acrophobia, is a common childhood phobia that typically emerges around the age of 2 or 3. Many children experience a fear of the dark at some point, but for some, this fear can become excessive and interfere with their daily lives. Children with a fear of the dark may refuse to sleep alone, have difficulty falling asleep, or experience nightmares. The fear of the dark can be attributed to a combination of factors, including a child's active imagination, a lack of understanding about what happens in the dark, and a fear of the unknown. Additionally, children may develop this phobia after experiencing a traumatic event or hearing scary stories or movies. To help children overcome their fear of the dark, parents can implement various strategies. Gradual exposure to darkness can be helpful, such as using a nightlight or gradually dimming the lights over time. Creating a comforting bedtime routine and providing reassurance can also help alleviate anxiety. Cognitive behavioral therapy, CBT techniques, such as challenging negative thoughts and using relaxation techniques, can be effective in treating this phobia. 9.4.2 Fear of animals. Many children develop specific phobias related to animals. Some common examples include a fear of dogs, cynophobia, a fear of snakes, ophidiophobia, a fear of insects, entomophobia, and a fear of birds, ornithophobia. These phobias can cause significant distress and anxiety when a child encounters the feared animal or even thinks about it. The fear of animals in children can stem from various factors, including a traumatic experience with an animal, witnessing others' fear or anxiety, or a lack of exposure to animals during early childhood. Media portrayals of animals as dangerous or threatening can also contribute to the development of these phobias. Treatment for animal phobias in children often involves gradual exposure therapy. This approach involves gradually introducing the child to the feared animal in a controlled and supportive environment. The child may start by looking at pictures of the animal, then progress to watching videos, and eventually have supervised interactions with the animal. This gradual exposure helps the child build confidence and overcome their fear. 9.4.3 Fear of medical procedures. Children may develop specific phobias related to medical procedures, such as a fear of needles, trypanophobia, or a fear of dentist's dentophobia. These phobias can make routine medical appointments or necessary treatments extremely challenging for both the child and their caregivers. The fear of medical procedures in children can be influenced by various factors, including previous negative experiences, a fear of pain or discomfort, or a lack of understanding about the purpose and process of medical procedures. Additionally, children may develop these phobias through observation, hearing others' negative experiences, or media portrayals of medical procedures as scary or painful. To help children overcome their fear of medical procedures, healthcare professionals can employ techniques such as distraction, relaxation techniques, and positive reinforcement. Providing age-appropriate information about the procedure and involving the child in decision-making can also help alleviate anxiety. In some cases, sedation or anesthesia may be necessary to ensure the child's comfort and cooperation during medical procedures. 9.4.4 Fear of school. Fear of school, also known as school phobia or school refusal, is a specific childhood phobia characterized by an intense fear or anxiety about attending school. Children with this phobia may experience physical symptoms such as stomach aches, headaches, or nausea when faced with the prospect of going to school. They may also exhibit clingy behavior, tantrums, or attempts to avoid school altogether. The fear of school can be caused by various factors, including separation anxiety, social anxiety, bullying, academic pressure, or traumatic experiences at school. Additionally, a child's temperament, family dynamics, or previous negative experiences can contribute to the development of this phobia. Treatment for school phobia often involves a multidisciplinary approach, including collaboration between parents, teachers, and mental health professionals. Gradual exposure to school, starting with short periods and gradually increasing, can help desensitize the child to their fear. Cognitive behavioral therapy (CBT) techniques, such as identifying and challenging negative thoughts, can also be beneficial. Creating a supportive and nurturing school environment and addressing any underlying issues contributing to the fear are essential for successful treatment. In conclusion, specific childhood phobias can significantly impact a child's daily life and well-being. Understanding the causes, symptoms, and treatment options for these phobias is crucial for parents, caregivers, and healthcare professionals. With appropriate support and intervention, children can overcome their fears and lead fulfilling lives. 10. Overcoming phobias. 10.1 Seeking professional help. When it comes to overcoming phobias, seeking professional help can be a crucial step in the journey towards recovery. While some individuals may be able to manage their phobias on their own, many people find that the guidance and support of a trained professional can make a significant difference in their progress. 10.1.1 The role of a mental health professional. Mental health professionals, such as psychologists and therapists, play a vital role in helping individuals overcome their phobias. These professionals have the knowledge and expertise to assess and diagnose phobias, as well as develop personalized treatment plans tailored to each individual's specific needs. During the initial assessment, the mental health professional will work closely with the individual to gain a comprehensive understanding of their phobia. This may involve discussing the specific triggers, the severity of the phobia, and any associated symptoms or challenges. By gathering this information, the professional can develop a treatment plan that addresses the unique needs of the individual. 10.1.2 Cognitive behavioral therapy (CBT). One of the most effective and widely used therapeutic approaches for treating phobias is cognitive behavioral therapy (CBT). CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to the phobia. In CBT, the individual works collaboratively with the therapist to challenge and reframe their irrational thoughts and beliefs about the phobia. Through various techniques, such as cognitive restructuring and exposure therapy, individuals learn to replace their fear-driven thoughts with more rational and realistic ones. Exposure therapy is a key component of CBT for phobias. It involves gradually exposing the individual to the feared object or situation in a controlled and supportive environment. By repeatedly facing their fear, individuals can learn to tolerate and eventually overcome their phobia. 10.1.3 Exposure therapy. Exposure therapy is a specific type of therapy that focuses on gradually exposing individuals to their phobia in a safe and controlled manner. The goal of exposure therapy is to help individuals confront their fears and learn that they are not as threatening as they may seem. During exposure therapy, the mental health professional will guide the individual through a series of progressively challenging situations related to their phobia. This may involve imagining the feared object or situation, looking at pictures or videos, or eventually facing the phobia in real life. The exposure is done in a gradual and systematic way, starting with less anxiety-provoking situations and gradually progressing to more challenging ones. The therapist provides support and guidance throughout the process, helping the individual develop coping strategies and manage their anxiety. 10.1.4 Relaxation techniques. In addition to therapy, mental health professionals may also teach individuals various relaxation techniques to help manage anxiety and stress associated with their phobia. These techniques can be used as a complement to therapy or as a standalone strategy for coping with phobia-related symptoms. Some common relaxation techniques include deep breathing exercises, progressive muscle relaxation, guided imagery, and mindfulness meditation. These techniques can help individuals calm their mind and body, reduce anxiety, and increase their overall sense of well-being. 10.1.5 Medication. In some cases, medication may be prescribed to help individuals manage the symptoms of their phobia. Medications such as anti-anxiety medications or beta blockers may be used to reduce anxiety and physical symptoms associated with phobias. It's important to note that medication alone is not considered a long-term solution for phobias. It is typically used in conjunction with therapy to provide temporary relief while individuals work on addressing the underlying causes of their phobia. 10.1.6 Support groups. Support groups can also be a valuable resource for individuals seeking professional help for their phobias. These groups provide a safe and supportive environment where individuals can share their experiences, learn from others, and gain encouragement and understanding. Support groups may be led by mental health professionals or facilitated by individuals who have successfully overcome their own phobias. Being part of a support group can help individuals feel less alone in their journey and provide them with additional strategies and insights for managing their phobia. 10.1.7 The importance of consistency and patience. Seeking professional help for a phobia is a significant step towards overcoming it, but it's important to remember that progress takes time and effort. Consistency and patience are key in the treatment process. It's essential to attend therapy sessions regularly, actively participate in the treatment plan, and practice the strategies and techniques learned in therapy consistently. Overcoming a phobia is a gradual process, and setbacks may occur along the way. However, with the support and guidance of a mental health professional, individuals can build the necessary skills and resilience to conquer their phobia. Remember, seeking professional help is a sign of strength and a commitment to improving your well-being. With the right support and treatment, you can overcome your phobia and live a life free from the constraints of fear. 10.2 Cognitive Behavioral Therapy. Cognitive behavioral therapy, CBT, is a widely recognized and effective treatment approach for phobias. It is a form of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to the development and maintenance of phobias. CBT helps individuals understand the connection between their thoughts, feelings, and behaviors, and empowers them to challenge and modify their irrational beliefs and fears. 10.2.1 Understanding CBT. CBT is based on the principle that our thoughts, emotions, and behaviors are interconnected. It recognizes that our thoughts can influence our emotions and behaviors, and vice versa. In the context of phobias, CBT aims to identify and challenge the irrational thoughts and beliefs that contribute to the intense fear and avoidance associated with specific situations or objects. The therapy typically involves a collaborative and structured approach between the therapist and the individual with the phobia. The therapist helps the individual identify their specific fears and the thoughts and behaviors that accompany them. Together, they work on developing strategies to change these patterns and replace them with more rational and adaptive ones. 10.2.2 Cognitive Restructuring. One of the key components of CBT for phobias is cognitive restructuring. This technique involves identifying and challenging the negative and irrational thoughts that contribute to the phobic response. The individual learns to question the accuracy and validity of their fearful thoughts and replace them with more realistic and balanced ones. For example, someone with a fear of flying may have thoughts like, "the plane will crash," or, "I won't be able to handle the anxiety." Through cognitive restructuring, they would learn to challenge these thoughts by examining the evidence for and against them. They might consider statistics on airplane safety or recall past experiences of successfully managing anxiety. By replacing irrational thoughts with more rational ones, the individual can reduce their fear and increase their confidence in facing the phobic situation. 10.2.3 Gradual Exposure. Another important aspect of CBT for phobias is gradual exposure. This technique involves systematically and gradually exposing the individual to the feared situation or object in a controlled and supportive environment. The exposure is done in a step-by-step manner, starting with less anxiety-provoking situations and gradually progressing to more challenging ones. The purpose of gradual exposure is to help the individual confront their fears in a safe and controlled way, allowing them to experience that their anxiety decreases over time. By repeatedly exposing themselves to the phobic stimulus, they can learn that their feared outcomes are unlikely to occur and that they have the ability to cope with their anxiety. 10.2.4 Behavioral Techniques. In addition to cognitive restructuring and gradual exposure, CBT for phobias may also incorporate various behavioral techniques. These techniques aim to help individuals develop new coping skills and behaviors that counteract their phobic response. One such technique is relaxation training, which involves teaching individuals relaxation exercises such as deep breathing, progressive muscle relaxation, and visualization. These techniques can help reduce anxiety and promote a sense of calmness when facing the phobic situation. Another behavioral technique commonly used in CBT is called systematic desensitization. This technique involves pairing relaxation techniques with a gradual exposure to the phobic stimulus. By associating relaxation with the feared situation, individuals can learn to replace their fear response with a more relaxed and calm state. 10.2.5 Effectiveness of CBT for phobias. Numerous research studies have demonstrated the effectiveness of CBT in treating phobias. CBT has been shown to significantly reduce phobic symptoms and improve overall functioning and quality of life. It is often considered the treatment of choice for specific phobias, social phobias, and other anxiety disorders. CBT is a time-limited therapy, typically lasting for a few months, depending on the severity of the phobia and individual progress. The therapy is highly structured and goal-oriented, with the individual actively participating in their treatment and practicing the skills learned outside of therapy sessions. 10.2.6 Seeking professional help. While self-help resources and techniques can be beneficial, it is important to seek professional help when dealing with phobias. A qualified therapist trained in CBT can provide guidance, support, and expertise in implementing the various techniques and strategies discussed. Therapy sessions may involve individual counseling, group therapy, or a combination of both, depending on the individual's needs and preferences. The therapist will tailor the treatment plan to address the specific phobia and its impact on the individual's life. Remember, overcoming a phobia takes time and effort. With the help of CBT and a supportive therapist, individuals can learn to manage their fears, challenge their negative thoughts, and gradually face their phobic situations with increased confidence and resilience. 10.3 Exposure Therapy. Exposure therapy is a widely recognized and effective treatment for phobias. It is a form of cognitive behavioral therapy that aims to reduce fear and anxiety by gradually exposing individuals to the objects or situations they fear. The goal of exposure therapy is to help individuals confront their fears in a safe and controlled environment, allowing them to learn that their fears are irrational and that they can cope with the anxiety they experience. 10.3.1 How exposure therapy works. Exposure therapy works by systematically exposing individuals to their feared objects or situations. This exposure can be done in two ways, through imaginal exposure or in vivo exposure. In imaginal exposure, individuals are asked to vividly imagine their feared object or situation. They are encouraged to describe the details of the scenario, including their thoughts, emotions, and physical sensations. This technique helps individuals confront their fears in a controlled environment and allows them to practice coping strategies. In vivo exposure, individuals are gradually exposed to their feared object or situation in real life. The exposure is carefully planned and structured, starting with situations that evoke mild anxiety and gradually progressing to more anxiety-provoking situations. For example, someone with a fear of flying may start by looking at pictures of airplanes, then progress to visiting an airport, and eventually take a short flight. During exposure therapy, individuals are encouraged to stay in the feared situation until their anxiety decreases. This process is known as habituation, and it helps individuals learn that their anxiety will naturally decrease over time. By repeatedly exposing themselves to their fears, individuals can break the cycle of avoidance and develop new, more adaptive responses. 10.3.2 The role of cognitive restructuring. In addition to exposure, cognitive restructuring is often incorporated into exposure therapy. Cognitive restructuring involves identifying and challenging negative thoughts and beliefs that contribute to fear and anxiety. By examining the evidence for and against these thoughts, individuals can develop more realistic and balanced thinking patterns. For example, someone with a fear of public speaking may have thoughts such as, "I will embarrass myself," or "everyone will judge me." Through cognitive restructuring, they can challenge these thoughts by considering alternative perspectives, such as, "I have prepared well for this presentation," or "most people in the audience are supportive." By combining exposure with cognitive restructuring, individuals can address both the emotional and cognitive aspects of their phobias. This comprehensive approach helps individuals develop a more accurate understanding of their fears and build confidence in their ability to cope with anxiety-provoking situations. 10.3.3 Gradual exposure and hierarchy construction. One of the key principles of exposure therapy is the use of gradual exposure. This means that individuals are exposed to their fears in a step-by-step manner, starting with situations that evoke mild anxiety and gradually progressing to more challenging situations. To facilitate this process, therapists often work with individuals to create a fear hierarchy. A fear hierarchy is a list of situations or stimuli related to the phobia, ranked from least to most anxiety-provoking. For example, someone with a fear of heights may create a hierarchy that includes looking at pictures of tall buildings, standing on a low balcony, and eventually standing on a high rooftop. By following the fear hierarchy, individuals can gradually confront their fears in a controlled and manageable way. This approach allows them to build confidence and develop effective coping strategies before moving on to more challenging situations. The gradual nature of exposure therapy helps to minimize overwhelming anxiety and increases the likelihood of successful outcomes. 10.3.4 Virtual reality exposure therapy. In recent years, virtual reality (VR) has emerged as a promising tool for exposure therapy. VR technology allows individuals to experience realistic simulations of their feared objects or situations in a safe and controlled environment. This can be particularly beneficial for individuals with phobias that are difficult to replicate in real life or for those who are unable to access certain environments. Virtual reality exposure therapy (VRET) provides a highly immersive and interactive experience, allowing individuals to confront their fears in a realistic and controlled manner. For example, someone with a fear of flying can use VR to experience being on an airplane, complete with the sights, sounds, and sensations associated with flying. Research has shown that VRET can be as effective as traditional exposure therapy in reducing phobia symptoms. It offers a convenient and accessible alternative for individuals who may have difficulty accessing in vivo exposure or who prefer a more controlled environment. 10.3.5 The benefits and effectiveness of exposure therapy. Exposure therapy has been extensively studied and has consistently shown to be highly effective in treating phobias. It has been found to produce long-lasting improvements in symptoms and overall functioning. One of the key benefits of exposure therapy is its efficiency. Compared to other forms of therapy, exposure therapy is often shorter in duration and requires fewer sessions. This makes it a cost-effective treatment option for individuals seeking relief from their phobias. Exposure therapy also empowers individuals to take an active role in their treatment. By confronting their fears head-on, individuals learn that they have the ability to overcome their anxiety and regain control over their lives. This sense of empowerment can have a positive impact on their overall well-being and self-confidence. Furthermore, exposure therapy can be used in conjunction with other treatment approaches, such as medication or relaxation techniques, to enhance its effectiveness. It can also be adapted to suit the specific needs and preferences of each individual, making it a highly flexible and personalized treatment option. In conclusion, exposure therapy is a highly effective treatment for phobias. By gradually exposing individuals to their fears, it helps them confront and overcome their anxiety in a safe and controlled environment. With the incorporation of cognitive restructuring and the use of virtual reality, exposure therapy continues to evolve and provide individuals with new opportunities for overcoming their phobias and living a life free from fear. 10.4 Relaxation Techniques. Relaxation techniques can be incredibly helpful for individuals who are struggling with phobias. These techniques aim to reduce anxiety and promote a sense of calmness, allowing individuals to better cope with their fears. By incorporating relaxation techniques into their daily routine, individuals can learn to manage their phobias more effectively and regain control over their lives. 10.4.1 Deep Breathing. Deep breathing is a simple yet powerful relaxation technique that can be practiced anywhere and at any time. By focusing on your breath and taking slow, deep breaths, you can activate your body's relaxation response and reduce feelings of anxiety. To practice deep breathing, find a quiet and comfortable place to sit or lie down. Close your eyes and take a slow, deep breath in through your nose, allowing your abdomen to rise as you fill your lungs with air. Hold your breath for a few seconds, and then exhale slowly through your mouth, allowing your abdomen to fall. Repeat this process several times, focusing on the sensation of your breath entering and leaving your body. 10.4.2 Progressive Muscle Relaxation. Progressive muscle relaxation is a technique that involves tensing and then releasing different muscle groups in the body to promote relaxation. By systematically tensing and relaxing each muscle group, individuals can become more aware of the physical sensations in their body and learn to release tension. To practice progressive muscle relaxation, find a quiet and comfortable place to sit or lie down. Start by tensing the muscles in your toes and feet for a few seconds, and then release the tension as you exhale. Move up to your calves, thighs, abdomen, chest, arms, and finally, your face and neck, tensing and releasing each muscle group as you go. As you release the tension, focus on the feeling of relaxation spreading throughout your body. 10.4.3 Guided Imagery. Guided imagery is a relaxation technique that involves using your imagination to create a calming and peaceful mental image. By visualizing yourself in a serene and safe environment, you can reduce anxiety and promote a sense of relaxation. To practice guided imagery, find a quiet and comfortable place to sit or lie down. Close your eyes and take a few deep breaths to relax your body and mind. Then, imagine yourself in a place that brings you joy and tranquility. It could be a beach, a forest, or any other location that makes you feel at ease. Engage all your senses and imagine the sights, sounds, smells, and textures of this place. Stay in this mental image for a few minutes, allowing yourself to fully immerse in the peacefulness of the scene. 10.4.4 Meditation. Meditation is a practice that involves focusing your attention and eliminating the stream of thoughts that may be causing stress and anxiety. By practicing meditation regularly, individuals can develop a greater sense of self-awareness and learn to let go of negative thoughts and emotions. To practice meditation, find a quiet and comfortable place to sit or lie down. Close your eyes and take a few deep breaths to center yourself. Focus your attention on a specific object, such as your breath, a mantra, or a candle flame. Whenever your mind starts to wander, gently bring your attention back to the object of focus. Start with short meditation sessions of just a few minutes and gradually increase the duration as you become more comfortable with the practice. 10.4.5 Yoga. Yoga combines physical postures, breathing exercises, and meditation to promote relaxation and reduce stress. The practice of yoga can help individuals connect their mind, body, and breath, creating a sense of harmony and balance. By engaging in regular yoga practice, individuals can improve their flexibility, strength, and overall well-being. There are various styles of yoga, ranging from gentle and restorative to more vigorous and dynamic. It is important to choose a style that suits your needs and abilities. Consider attending a yoga class or following along with online tutorials to learn the proper techniques and ensure a safe practice. 10.4.6 Aromatherapy. Aromatherapy involves the use of essential oils to promote relaxation and reduce anxiety. Certain scents, such as lavender, chamomile, and bergamot, have been found to have calming effects on the mind and body. To incorporate aromatherapy into your relaxation routine, you can use essential oils in a diffuser, add a few drops to a warm bath, or apply them topically using a carrier oil. Take a moment to inhale the scent deeply and allow it to envelop your senses. Experiment with different essential oils to find the scents that resonate with you and help you feel more relaxed. 10.4.7 Mindfulness. Mindfulness is the practice of being fully present in the moment and non-judgmentally observing your thoughts, feelings, and sensations. By cultivating mindfulness, individuals can develop a greater sense of acceptance and reduce their reactivity to stressful situations. To practice mindfulness, find a quiet and comfortable place to sit or lie down. Close your eyes and take a few deep breaths to center yourself. Bring your attention to the present moment and observe your thoughts and sensations without judgment. If your mind starts to wander, gently bring your focus back to the present moment. Mindfulness can be practiced throughout the day, not just during formal meditation sessions, by bringing your attention to your current activity and fully engaging in it. 10.4.8 Music Therapy. Music has a powerful impact on our emotions and can be used as a tool for relaxation. Listening to calming and soothing music can help reduce anxiety and promote a sense of tranquility. Create a playlist of your favorite relaxing songs or explore genres specifically designed for relaxation, such as classical music or nature sounds. Find a quiet and comfortable place to sit or lie down, close your eyes, and allow the music to wash over you. Focus on the melodies, rhythms, and harmonies, and let the music transport you to a state of relaxation. Incorporating relaxation techniques into your daily routine can significantly help in managing phobias. Experiment with different techniques and find the ones that resonate with you the most. Remember, relaxation is a skill that takes practice, so be patient with yourself as you embark on this journey towards overcoming your fears. 11. Living with phobias. 11.1 Managing daily life. Living with phobias can be challenging, as they can significantly impact your daily life and overall well-being. However, with the right strategies and support, it is possible to manage and cope with your fears effectively. In this section, we will explore some practical tips and techniques to help you navigate through your daily life while living with phobias. 11.1.1 Understanding your triggers. One of the first steps in managing daily life with phobias is to identify and understand your triggers. Take some time to reflect on the situations, objects, or environments that provoke your fear response. By recognizing your triggers, you can develop strategies to avoid or minimize exposure to them, which can help reduce anxiety and stress. 11.1.2 Creating a safe environment. Creating a safe and comfortable environment is essential when living with phobias. Make your home a sanctuary where you feel secure and at ease. Remove any objects or reminders that may trigger your fears, and surround yourself with things that bring you comfort and relaxation. Consider incorporating calming elements such as soft lighting, soothing scents, or relaxing music to create a peaceful atmosphere. 11.1.3 Establishing a routine. Having a structured daily routine can provide a sense of stability and control, which can be particularly beneficial for individuals with phobias. Plan your day in advance, including regular activities, breaks, and self-care time. By following a routine, you can create a predictable and manageable schedule that helps reduce anxiety and provides a sense of order in your life. 11.1.4 Seeking support. Living with phobias can feel isolating, but remember that you are not alone. Reach out to friends, family, or support groups who can provide understanding, empathy, and encouragement. Sharing your experiences with others who have similar fears can be incredibly validating and can offer valuable insights and coping strategies. Additionally, consider seeking professional help from therapists or counselors who specialize in anxiety disorders and phobias. 11.1.5 Educating yourself. Knowledge is power when it comes to managing phobias. Educate yourself about your specific phobia, its causes, and available treatment options. Understanding the nature of your fear can help demystify it and make it feel more manageable. Research different coping techniques, relaxation exercises, and self-help strategies that have been proven effective for individuals with phobias. The more you know, the better equipped you will be to face your fears. 11.1.6 Practicing self-care. Taking care of yourself is crucial when living with phobias. Make self-care a priority in your daily life. Engage in activities that bring you joy and relaxation, such as practicing mindfulness, exercising, reading, or pursuing hobbies. Prioritize getting enough sleep, eating nutritious meals, and maintaining a healthy lifestyle. Taking care of your physical and mental well-being can help reduce stress and improve your overall resilience. 11.1.7 Using relaxation techniques. When anxiety and fear arise, it can be helpful to have a toolbox of relaxation techniques to rely on. Deep breathing exercises, progressive muscle relaxation, and guided imagery are just a few examples of relaxation techniques that can help calm your mind and body. Experiment with different techniques to find what works best for you, and practice them regularly to build your relaxation skills. 11.1.8 Setting realistic goals. Setting realistic goals is essential when managing daily life with phobias. Break down larger tasks into smaller, more manageable steps. By setting achievable goals, you can gradually expose yourself to your fears in a controlled and safe manner. Celebrate each milestone and acknowledge your progress, no matter how small. Remember, overcoming phobias is a journey, and every step forward is a significant achievement. 11.1.9 Practicing mindfulness. Mindfulness is a powerful tool for managing phobias. By staying present and fully aware of your thoughts, feelings, and bodily sensations, you can learn to observe your fears without judgment or attachment. Mindfulness practices, such as meditation or mindful breathing, can help you develop a greater sense of self-awareness and cultivate a more compassionate and accepting attitude towards your fears. 11.1.10 Seeking professional help. If your phobias significantly impact your daily life and hinder your ability to function, it may be beneficial to seek professional help. Therapists and counselors can provide specialized guidance and support tailored to your specific needs. They can help you explore the root causes of your phobias, develop coping strategies, and guide you through evidence-based treatments such as cognitive behavioral therapy, CBT, or exposure therapy. Remember, managing daily life with phobias is a journey that requires patience, self-compassion, and perseverance. With the right strategies, support, and a willingness to face your fears, you can gradually regain control over your life and live it to the fullest, free from the limitations imposed by your phobias. 11.2 Support systems. Living with phobias can be challenging, but having a strong support system in place can make a significant difference in managing and overcoming your fears. Support systems provide emotional, practical, and social support, helping individuals with phobias navigate their daily lives and work towards conquering their fears. In this section, we will explore the importance of support systems and discuss different types of support available. 11.2.1 Family and Friends. Family and friends play a crucial role in supporting individuals with phobias. They can provide a safe and understanding environment where individuals feel comfortable discussing their fears and seeking reassurance. Loved ones can offer emotional support, encouragement, and empathy, helping individuals feel less alone in their struggles. They can also assist in practical ways, such as accompanying them to therapy sessions or helping them with exposure exercises. It is essential for family and friends to educate themselves about phobias to better understand the challenges their loved ones face. By learning about the specific phobia and its symptoms, they can offer appropriate support and avoid triggering situations. Additionally, they can help individuals identify and challenge negative thoughts and beliefs associated with their phobias, promoting a more positive mindset. 11.2.2 Support Groups. Support groups provide a valuable platform for individuals with phobias to connect with others who share similar experiences. These groups offer a safe and non-judgmental space where individuals can discuss their fears, share coping strategies, and offer support to one another. Being part of a support group can help individuals realize that they are not alone in their struggles and provide a sense of belonging. Support groups can be found in various formats, including in-person meetings, online forums, and social media groups. They can be specific to a particular phobia or more general, focusing on anxiety disorders or mental health. Participating in support groups allows individuals to learn from others' experiences, gain insights into different coping mechanisms, and receive encouragement from those who have successfully overcome their phobias. 11.2.3 Mental Health Professionals. Seeking professional help is crucial for individuals with phobias, and mental health professionals play a vital role in providing support and guidance. Therapists, psychologists, and counselors specializing in anxiety disorders can help individuals understand the root causes of their phobias, develop coping strategies, and work towards overcoming their fears. Cognitive behavioral therapy, CBT, is a common therapeutic approach used to treat phobias. It focuses on identifying and challenging negative thoughts and beliefs associated with the phobia, gradually exposing individuals to their fears, and teaching them effective coping mechanisms. Mental health professionals can guide individuals through the CBT process, providing support and encouragement along the way. In some cases, medication may be prescribed to manage the symptoms of phobias. Mental health professionals can assess the need for medication and work with individuals to find the most suitable treatment plan. Regular therapy sessions provide individuals with a safe space to discuss their progress, address any concerns or setbacks, and receive ongoing support. 11.2.4 Online Resources. The internet offers a wealth of resources for individuals with phobias, providing information, support, and self-help tools. Online platforms, such as websites, forums, and mobile applications, can be valuable sources of knowledge and guidance. These resources often include articles, videos, and interactive tools that help individuals understand their phobias, learn coping strategies, and connect with others facing similar challenges. Online therapy platforms have also gained popularity, offering individuals the convenience of accessing therapy sessions from the comfort of their homes. These platforms connect individuals with licensed therapists who specialize in anxiety disorders and phobias, providing professional support through video calls, messaging, or phone sessions. However, it is essential to approach online resources with caution and ensure the credibility of the information and the qualifications of the professionals involved. Consulting mental health professionals or reputable organizations can help individuals identify reliable online resources. 11.2.5 Self-help books and materials. Self-help books and materials can be valuable tools for individuals with phobias, providing guidance, strategies, and inspiration. These resources often offer practical advice on managing phobias, overcoming fears, and building resilience. They may include exercises, worksheets, and case studies that individuals can use to explore their fears and develop coping mechanisms. When choosing self-help materials, it is important to consider the credibility of the author and ensure that the content aligns with evidence-based approaches. Reading reviews and seeking recommendations from mental health professionals or support groups can help individuals find reliable and helpful resources. 11.2.6 Workplace Support. Support in the workplace is crucial for individuals with phobias, as it can significantly impact their job performance and overall well-being. Employers can play a role in creating a supportive work environment by promoting understanding and awareness of phobias. This can include providing education and training for employees, implementing reasonable accommodations, and fostering a culture of inclusivity and support. Colleagues can also contribute to a supportive workplace by being understanding and accommodating. Simple gestures, such as offering reassurance, providing assistance during challenging situations, or allowing individuals to take breaks when needed, can make a significant difference in helping individuals manage their phobias at work. Conclusion. Having a strong support system is essential for individuals living with phobias. Family and friends, support groups, mental health professionals, online resources, self-help materials, and workplace support all contribute to creating a network of support that can help individuals navigate their daily lives and work towards overcoming their fears. By seeking and utilizing these support systems, individuals with phobias can find the encouragement, understanding, and guidance they need to live fulfilling lives free from the constraints of their fears. 11.3 Self-care strategies. Living with phobias can be challenging, but there are several self-care strategies that can help individuals cope with their fears and manage their daily lives more effectively. These strategies focus on promoting overall well-being and reducing anxiety levels. While self-care strategies may not completely eliminate phobias, they can provide individuals with the tools and techniques to better navigate their fears and improve their quality of life. 11.3.1 Prioritize self-care. Taking care of oneself is crucial when living with phobias. It is important to prioritize self-care activities that promote physical, mental, and emotional well-being. This includes getting enough sleep, eating a balanced diet, and engaging in regular exercise. Taking care of your physical health can help reduce stress and anxiety levels, making it easier to manage phobias. 11.3.2 Practice relaxation techniques. Relaxation techniques can be highly effective in managing anxiety associated with phobias. Deep breathing exercises, progressive muscle relaxation, and meditation are all techniques that can help calm the mind and body. These techniques can be practiced regularly to reduce overall anxiety levels and provide a sense of calm during moments of fear or panic. 11.3.3 Challenge negative thoughts. Phobias are often fueled by negative thoughts and irrational beliefs. Challenging these thoughts and replacing them with more rational and positive ones can be helpful in managing phobias. Cognitive behavioral therapy (CBT) techniques, such as cognitive restructuring, can assist individuals in identifying and changing negative thought patterns. By challenging these thoughts, individuals can gain a more realistic perspective on their fears and reduce anxiety levels. 11.3.4 Gradual exposure. Gradual exposure is a technique commonly used in exposure therapy, a form of treatment for phobias. This technique involves gradually exposing oneself to the feared object or situation in a controlled and safe manner. By gradually facing their fears, individuals can desensitize themselves to the phobic stimulus and reduce anxiety over time. It is important to start with small steps and gradually increase exposure to prevent overwhelming feelings of fear. 11.3.5 Seek support. Building a support system is essential when living with phobias. Surrounding oneself with understanding and supportive individuals can provide a sense of comfort and encouragement. Friends, family members, or support groups can offer a safe space to share experiences, seek advice, and receive emotional support. Connecting with others who have similar experiences can also help individuals realize that they are not alone in their struggles. 11.3.6 Practice mindfulness. Mindfulness is the practice of being fully present in the moment and non-judgmentally observing one's thoughts and feelings. It can be a powerful tool in managing phobias by helping individuals stay grounded and focused on the present rather than getting caught up in anxious thoughts about the future. Mindfulness techniques, such as meditation and body scans, can be practiced regularly to cultivate a sense of calm and reduce anxiety levels. 11.3.7 Educate yourself. Knowledge is empowering when it comes to managing phobias. Educating yourself about your specific phobia can help you understand its causes, symptoms, and treatment options. Learning about the experiences of others who have successfully overcome similar phobias can provide inspiration and motivation. By becoming more informed, you can make more informed decisions about your treatment and develop a greater sense of control over your fears. 11.3.8 Set realistic goals. Setting realistic goals is important when living with phobias. It is essential to break down larger goals into smaller, manageable steps. By setting achievable goals, individuals can gradually work towards overcoming their fears and building confidence. Celebrating each milestone along the way can provide a sense of accomplishment and motivation to continue pushing forward. 11.3.9 Practice self-compassion. Living with phobias can be challenging, and it is important to be kind and compassionate towards oneself. Acknowledge that facing fears takes courage and that setbacks are a normal part of the journey. Treat yourself with kindness and understanding, and avoid self-criticism. Practicing self-compassion can help individuals navigate their fears with greater resilience and self-acceptance. 11.3.10 Seek professional help. While self-care strategies can be beneficial, it is important to recognize when professional help is needed. If phobias significantly interfere with daily life or cause extreme distress, seeking the assistance of a mental health professional is recommended. They can provide specialized treatment options, such as cognitive behavioral therapy or medication, tailored to individual needs. Living with phobias can be challenging, but by implementing self-care strategies, individuals can effectively manage their fears and improve their overall well-being. Prioritizing self-care, practicing relaxation techniques, challenging negative thoughts, and seeking support are all important steps in living a fulfilling life despite phobias. Remember, everyone's journey is unique, and it is essential to find the strategies that work best for you. 11.4 Building resilience. Building resilience is an essential aspect of living with phobias. It involves developing the ability to bounce back from challenging situations and cope with the fear and anxiety that phobias can bring. Resilience is not something that comes naturally to everyone, but it can be cultivated and strengthened over time. In this section, we will explore some strategies and techniques that can help individuals with phobias build resilience and lead fulfilling lives. 11.4.1 Understanding resilience. Resilience is the ability to adapt and recover from adversity, stress, or trauma. It is not about eliminating fear or phobias entirely but rather learning to manage and navigate them effectively. Building resilience involves developing a set of skills and strategies that can help individuals face their fears and overcome challenges. It is a process that requires time, patience, and practice. 11.4.2 Acceptance and mindfulness. One of the first steps in building resilience is accepting the presence of phobias and acknowledging their impact on daily life. Acceptance does not mean giving up or resigning oneself to a life controlled by fear. Instead, it involves recognizing that phobias are a part of who you are and that it is possible to live a fulfilling life despite them. Mindfulness can be a powerful tool in building resilience. By practicing mindfulness, individuals can learn to observe their thoughts and emotions without judgment. This allows them to develop a greater sense of self-awareness and a deeper understanding of their phobias. Mindfulness techniques, such as deep breathing exercises and meditation, can also help individuals stay present in the moment and reduce anxiety. 11.4.3 Building a support network. Having a strong support network is crucial for building resilience. Surrounding yourself with understanding and supportive individuals can provide a sense of comfort and encouragement when facing fears and challenges. Friends, family members, support groups, or therapists can offer guidance, empathy, and practical advice. It is important to communicate openly with your support network about your phobias and how they affect your life. By sharing your experiences and feelings, you can gain valuable insights and perspectives. Additionally, your support network can help you identify triggers, develop coping strategies, and celebrate your progress. 11.4.4 Developing coping strategies. Developing effective coping strategies is an integral part of building resilience. Coping strategies are techniques or actions that individuals can use to manage their fears and anxieties. Different strategies work for different people, so it is essential to explore and experiment with various approaches to find what works best for you. Some common coping strategies include deep breathing. Deep breathing exercises can help calm the body and mind during moments of anxiety or panic. By focusing on slow, deep breaths, individuals can activate the body's relaxation response and reduce the intensity of fear. Visualization. Visualization involves creating mental images of calm and peaceful scenes. By imagining yourself in a safe and relaxing environment, you can help reduce anxiety and promote a sense of calmness. Positive self-talk. Positive self-talk involves replacing negative thoughts and beliefs with positive and empowering ones. By challenging negative self-talk and replacing it with affirmations and encouraging statements, individuals can build resilience and boost their confidence. Gradual exposure. Gradual exposure is a technique commonly used in therapy to help individuals confront their fears in a controlled and gradual manner. By gradually exposing themselves to the feared object or situation, individuals can desensitize themselves and reduce their anxiety over time. Physical exercise. Engaging in regular physical exercise can have a positive impact on mental health and resilience. Exercise releases endorphins, which are natural mood boosters, and can help reduce anxiety and stress. 11.4.5 Setting realistic goals. Setting realistic goals is an important aspect of building resilience. By breaking down larger goals into smaller, manageable steps, individuals can make progress and build confidence along the way. Setting achievable goals allows individuals to experience success and reinforces their belief in their ability to overcome challenges. It is essential to be patient and kind to yourself during the goal-setting process. Remember that progress takes time, and setbacks are a natural part of the journey. Celebrate even the smallest victories and use them as motivation to continue moving forward. 11.4.6 Seeking professional help. Building resilience can be a challenging process, and it is okay to seek professional help. Therapists, counselors, or psychologists with experience in treating phobias can provide valuable guidance and support. They can help individuals develop personalized strategies, provide a safe space to explore fears, and offer evidence-based techniques to manage anxiety. Professional help can also be beneficial in addressing any underlying issues or traumas that may contribute to the development or maintenance of phobias. Therapy can provide individuals with the tools and resources they need to build resilience and lead fulfilling lives. 11.4.7 Embracing growth and celebrating progress. Building resilience is a journey of growth and self-discovery. It is important to embrace the process and recognize that setbacks and challenges are opportunities for learning and growth. Each step taken towards facing fears and overcoming phobias is a significant achievement. Celebrate your progress along the way. Whether it is a small step forward or a major milestone, acknowledge and reward yourself for your efforts. Celebrating progress can help reinforce positive behaviors and motivate you to continue building resilience. Remember, building resilience is a lifelong process. It requires patience, perseverance, and a commitment to self-care. By implementing these strategies and techniques, individuals with phobias can cultivate resilience and live fulfilling lives despite their fears. 12. Conquering fear. 12.1 Facing your fears. Facing your fears is a crucial step in overcoming phobias. It involves confronting the specific situations or objects that trigger your fear response. While it may seem daunting at first, facing your fears is an essential part of the journey towards conquering your phobia. In this section, we will explore the importance of facing your fears and provide strategies to help you navigate this challenging process. The importance of facing your fears. Avoidance is a common coping mechanism for individuals with phobias. It provides temporary relief from anxiety and fear, but it also reinforces the phobia, making it more difficult to overcome in the long run. By avoiding the situations or objects that trigger your fear, you inadvertently strengthen the association between the phobia and the feeling of danger. Facing your fears, on the other hand, allows you to challenge and reevaluate your beliefs about the perceived threat. It provides an opportunity to learn that the feared situation or object is not as dangerous as your mind has led you to believe. By gradually exposing yourself to the source of your fear, you can desensitize your response and reduce anxiety over time. Gradual exposure. One effective approach to facing your fears is through gradual exposure. This technique involves systematically exposing yourself to the feared situation or object in a controlled and gradual manner. The goal is to start with situations or objects that provoke mild anxiety and gradually work your way up to more challenging scenarios. For example, if you have a fear of flying, arachnophobia, you can begin by looking at pictures of airplanes or watching videos of flights. As you become more comfortable, you can progress to visiting an airport, sitting in an airplane without taking off, and eventually taking short flights. By breaking down the fear-inducing situation into smaller, manageable steps, you can build confidence and reduce anxiety along the way. It is important to note that the pace of exposure should be determined by your comfort level. Pushing yourself too quickly can lead to overwhelming anxiety and setbacks. Gradual exposure allows you to take control of your progress and ensures that you are consistently challenging yourself without becoming overwhelmed. Positive affirmations. Positive affirmations are another powerful tool in facing your fears. Affirmations are positive statements that you repeat to yourself to challenge negative thoughts and beliefs. They can help shift your mindset from fear and self-doubt to confidence and empowerment. When facing your fears, it is common to experience self-doubt and negative self-talk. Positive affirmations can counteract these negative thoughts and provide a sense of reassurance and encouragement. By repeating affirmations such as, "I am capable of overcoming my fears," or, "I am strong and resilient," you can cultivate a more positive and empowering mindset. It is important to choose affirmations that resonate with you personally. Reflect on the specific fears you are facing and create affirmations that address those fears directly. Write them down and repeat them regularly, especially when you are in the midst of confronting your phobia. Over time, positive affirmations can help rewire your thought patterns and boost your confidence in facing your fears. Celebrating progress. Celebrating your progress is an essential part of the journey towards conquering your fears. Each step you take towards facing your fears deserves recognition and celebration. By acknowledging your achievements, you reinforce the positive changes you are making and motivate yourself to continue moving forward. Celebrate both small and big milestones along the way. Whether it's successfully completing a challenging exposure exercise or simply showing up to face your fear, every step counts. Treat yourself to something you enjoy, share your achievements with a supportive friend or family member, or reward yourself with a relaxing activity. By celebrating your progress, you create a positive association with facing your fears and strengthen your motivation to continue overcoming your phobia. Remember, facing your fears is a courageous act that requires patience and perseverance. It is normal to experience setbacks and moments of doubt along the way. Be kind to yourself and seek support from loved ones or professionals if needed. With time and dedication, you can conquer your fears and live a life free from the limitations of phobias. 12.2 Gradual exposure. Gradual exposure is a widely recognized and effective technique used in the treatment of phobias. It involves facing one's fears in a controlled and systematic manner, gradually increasing the level of exposure over time. This approach allows individuals to confront their phobias in a safe and supportive environment, helping them to overcome their fears and regain control over their lives. 12.2.1 Understanding gradual exposure. Gradual exposure works on the principle of desensitization, which aims to reduce the anxiety and fear associated with a specific phobia. The process involves exposing oneself to the feared object or situation in a gradual and controlled manner, starting with less anxiety-provoking scenarios and gradually progressing to more challenging ones. By repeatedly exposing oneself to the feared stimulus, the individual becomes desensitized to it, and the fear response diminishes over time. 12.2.2 Creating a hierarchy. Before starting gradual exposure, it is essential to create a hierarchy of fear-inducing situations or stimuli related to the phobia. This hierarchy serves as a roadmap for the exposure process, with each step representing a progressively more challenging level of fear. For example, if someone has a fear of flying, the hierarchy may include steps such as looking at pictures of airplanes, visiting an airport, sitting in an airplane without taking off, and finally, taking a short flight. 12.2.3 Taking small steps. The key to successful gradual exposure is taking small, manageable steps. It is crucial to start with situations or stimuli that evoke mild anxiety and gradually work up to more intense ones. By breaking down the fear-inducing scenario into smaller, achievable steps, individuals can build confidence and gradually increase their tolerance for anxiety. This approach helps prevent overwhelming feelings and ensures a more successful outcome. 12.2.4 Controlled exposure. During gradual exposure, it is essential to maintain a sense of control and safety. Exposure should be done in a controlled environment, preferably with the guidance of a mental health professional. This ensures that the individual feels supported and can manage their anxiety effectively. The exposure sessions should be planned and structured, allowing the person to gradually face their fears while feeling secure and in control. 12.2.5 Utilizing relaxation techniques. In conjunction with gradual exposure, individuals can benefit from incorporating relaxation techniques into their treatment plan. Deep breathing exercises, progressive muscle relaxation, and mindfulness techniques can help reduce anxiety and promote a sense of calm during exposure sessions. These techniques can be practiced before, during, and after exposure, providing a valuable tool for managing anxiety and enhancing the effectiveness of the exposure process. 12.2.6 Support and encouragement. Having a strong support system is crucial when undergoing gradual exposure. Friends, family, or support groups can provide encouragement, understanding, and reassurance throughout the process. Sharing experiences with others who have faced similar fears can be empowering and motivating. Additionally, the guidance and support of a mental health professional can play a vital role in ensuring the success of gradual exposure therapy. 12.2.7 Tracking progress. Tracking progress is an essential aspect of gradual exposure therapy. Keeping a record of each exposure session, including the level of anxiety experienced and any changes in fear response, can help individuals recognize their progress over time. This record serves as a tangible reminder of their achievements and can provide motivation during challenging moments. Celebrating milestones and acknowledging progress can further boost confidence and reinforce the effectiveness of gradual exposure. 12.2.8 Patience and persistence. Overcoming a phobia through gradual exposure requires patience and persistence. It is essential to remember that progress may not always be linear, and setbacks can occur. However, with dedication and perseverance, individuals can continue to move forward and conquer their fears. Each step taken, no matter how small, brings them closer to a life free from the limitations imposed by their phobia. 12.2.9 Seeking professional help. While gradual exposure can be a highly effective technique, it is important to seek the guidance of a qualified mental health professional. They can provide the necessary support, guidance, and expertise to ensure a safe and successful exposure process. A professional can tailor the treatment plan to the individual's specific needs, monitor progress, and provide additional therapeutic interventions if required. 12.2.10 Embracing a fear-free future. Gradual exposure offers individuals the opportunity to confront their fears head-on and reclaim their lives. By gradually facing their phobias, individuals can develop resilience, build confidence, and experience a sense of empowerment. With the right support, dedication, and a willingness to step outside their comfort zone, individuals can overcome their phobias and embrace a fear-free future. 12.3 Positive affirmations. Positive affirmations are powerful tools that can help individuals overcome their fears and phobias. Affirmations are positive statements that are repeated regularly to reinforce positive beliefs and thoughts. By using positive affirmations, individuals can reprogram their subconscious mind and replace negative thoughts and fears with positive and empowering ones. In this section, we will explore the benefits of positive affirmations and provide some examples that can be used to conquer fear. 12.3.1 The power of positive affirmations. Positive affirmations work by rewiring the neural pathways in the brain. When we repeat positive statements, our brain starts to believe them and creates new connections that support these beliefs. This process helps to shift our mindset from fear and negativity to confidence and empowerment. By consistently practicing positive affirmations, individuals can change their thought patterns and develop a more positive and resilient mindset. Positive affirmations also help to counteract the negative self-talk that often accompanies phobias. When faced with a fear or phobia, individuals may experience a barrage of negative thoughts and beliefs about themselves and their abilities. Positive affirmations can interrupt this negative self-talk and replace it with positive and encouraging messages. By repeating affirmations, individuals can build self-confidence and develop a more optimistic outlook. 12.3.2 Creating effective positive affirmations. To create effective positive affirmations, it is important to keep a few key principles in mind. Use the present tense. Affirmations should be stated in the present tense as if the desired outcome has already been achieved. For example, instead of saying, "I will overcome my fear of spiders," say, "I am confident and fearless around spiders." Be specific. It is important to be specific when creating affirmations. Instead of using general statements, focus on the specific fear or phobia you want to overcome. For example, instead of saying, "I am fearless," say, "I am calm and confident when speaking in public." Use positive language. Affirmations should always be framed in a positive and empowering way. Avoid using negative words or phrases. For example, instead of saying, "I am not afraid of heights," say, "I am courageous and at ease when I am at great heights." Believe in the affirmation. It is crucial to believe in the affirmations you are using. If you have doubts or skepticism, it may be helpful to start with more neutral affirmations and gradually build up to more empowering ones as your belief strengthens. 12.3.3 Examples of positive affirmations. Here are some examples of positive affirmations that can be used to conquer fear and phobias. I am strong and capable of facing my fears. I am in control of my thoughts and emotions. I release all fear and embrace courage and confidence. I am safe and protected in every situation. I am resilient and can overcome any challenge that comes my way. I trust myself to handle any fear or phobia that arises. I am worthy of living a life free from fear. I am surrounded by love and support as I conquer my fears. I am becoming more fearless and confident every day. I am grateful for the opportunities to grow and overcome my fears. Remember, the key to using positive affirmations effectively is consistency and repetition. Repeat your chosen affirmations daily, preferably in front of a mirror, and truly believe in the power of your words. Over time, you will start to notice a shift in your mindset and a decrease in the intensity of your fears and phobias. 12.3.4 Integrating positive affirmations into daily life. To make positive affirmations a part of your daily routine, consider the following tips. Create a daily affirmation practice. Set aside a specific time each day to repeat your affirmations. This could be in the morning, before bed, or during a quiet moment in your day. Consistency is key, so make it a habit. Write them down. Write your affirmations on sticky notes or in a journal. Seeing them written down can reinforce their message and make them more tangible. Use visualization. As you repeat your affirmations, visualize yourself successfully overcoming your fears and phobias. Imagine yourself feeling confident, calm, and in control. Combine affirmations with deep breathing or meditation. Incorporate deep breathing or meditation techniques while repeating your affirmations. This can help to relax your mind and body, making the affirmations more effective. Seek support. Share your affirmations with a trusted friend or family member who can provide encouragement and accountability. Having someone to support you on your journey can make a significant difference. Remember, positive affirmations are just one tool in the journey of conquering fear and phobias. It is important to combine them with other strategies such as therapy, exposure techniques, and self-care practices to achieve lasting results. With dedication and perseverance, you can overcome your fears and live a life free from the limitations of phobias. 12.4 Celebrating progress. Overcoming phobias is a challenging and courageous journey. It takes time, effort, and determination to face our fears head-on and work towards conquering them. Throughout this process, it is important to acknowledge and celebrate the progress we make along the way. Celebrating our achievements not only boosts our self-confidence but also reinforces our motivation to continue pushing forward. In this section, we will explore the significance of celebrating progress and discuss some effective ways to do so. 12.4.1 Recognizing small victories. When it comes to conquering phobias, every step forward is a victory. It is crucial to recognize and celebrate even the smallest achievements. Whether it's attending a social gathering without feeling overwhelmed or being able to handle a spider without panicking, these accomplishments deserve recognition. By acknowledging and celebrating these small victories, we reinforce positive behavior and build confidence in our ability to overcome our fears. 12.4.2 Setting milestones. Setting milestones is an effective way to track progress and provide a sense of direction in our journey towards conquering our phobias. These milestones can be specific goals that we aim to achieve within a certain time frame. For example, if someone has a fear of flying, their milestones could include booking a flight, boarding the plane, and eventually taking a short flight. By breaking down the process into smaller, manageable steps, we can celebrate each milestone as we move closer to our ultimate goal. 12.4.3 Rewarding yourself. Rewarding ourselves for our achievements is an important part of the progress celebration process. By treating ourselves to something special or indulging in a favorite activity, we reinforce the positive association with overcoming our fears. The rewards can be as simple as enjoying a relaxing day at the spa, treating ourselves to a delicious meal, or buying something we've been wanting for a while. These rewards serve as reminders of our accomplishments and provide motivation to continue pushing forward. 12.4.4 Sharing success stories. Sharing our success stories with others who understand and support us can be incredibly empowering. Whether it's with a close friend, a support group, or an online community, sharing our progress allows us to celebrate our achievements and inspire others who may be on a similar journey. By sharing our experiences, we not only celebrate our own progress but also contribute to a supportive and encouraging environment for others facing similar challenges. 12.4.5 Journaling and reflection. Keeping a journal throughout our journey can be a powerful tool for celebrating progress. By documenting our experiences, thoughts, and emotions, we can track our growth and reflect on how far we have come. Reading through our journal entries and seeing the progress we have made can be a source of motivation and celebration. Additionally, journaling allows us to identify patterns, triggers, and coping strategies that have been effective, further enhancing our ability to overcome our phobias. 12.4.6 Seeking validation. Seeking validation from trusted individuals can be an important part of celebrating progress. Sharing our achievements with loved ones who understand the significance of our accomplishments can provide a sense of validation and support. Their encouragement and recognition can boost our self-esteem and reinforce our belief in our ability to conquer our fears. Whether it's a family member, a close friend, or a therapist, seeking validation from those who genuinely care about our well-being can be a powerful motivator. 12.4.7 Embracing self-care. Taking care of ourselves throughout the process of overcoming phobias is essential. Celebrating progress can involve practicing self-care activities that promote relaxation, reduce stress, and enhance overall well-being. Engaging in activities such as meditation, yoga, exercise, or spending time in nature can help us recharge and celebrate the progress we have made. By prioritizing self-care, we acknowledge the importance of our mental and emotional health in our journey towards conquering our fears. 12.4.8 Cultivating a supportive environment. Creating a supportive environment is crucial for celebrating progress and maintaining motivation. Surrounding ourselves with individuals who understand and support our goals can make a significant difference in our journey. Whether it's joining a support group, attending therapy sessions, or seeking guidance from a mentor, having a strong support system can provide encouragement, accountability, and celebration of our progress. By cultivating a supportive environment, we create a space where our achievements are acknowledged and celebrated. 12.4.9 Reflecting on personal growth. Celebrating progress goes beyond acknowledging external achievements. It also involves reflecting on our personal growth and the internal changes we have experienced throughout our journey. Taking the time to reflect on how we have become more resilient, courageous, and self-aware can be a powerful way to celebrate our progress. By recognizing the personal growth we have achieved, we reinforce our belief in our ability to overcome our fears and continue moving forward. 12.4.10 Embracing a positive mindset. Maintaining a positive mindset is crucial when celebrating progress. It is important to focus on the progress we have made rather than dwelling on setbacks or challenges. By embracing a positive mindset, we can celebrate each step forward and use any setbacks as learning opportunities. Cultivating gratitude for the progress we have made and the lessons we have learned along the way allows us to celebrate our journey towards conquering our phobias. In conclusion, celebrating progress is an essential part of the journey towards conquering our phobias. By recognizing and celebrating our achievements, setting milestones, rewarding ourselves, sharing success stories, journaling, seeking validation, embracing self-care, cultivating a supportive environment, reflecting on personal growth, and embracing a positive mindset, we reinforce our motivation, boost our self-confidence, and continue moving forward on the path to overcoming our fears. Remember, every step forward is a victory worth celebrating.